Hello, everyone. It's so good to see that so many of you showed up today. I'm just going to take a moment to try and admit the last people from the waiting room because more and more people are joining, and it's very difficult for me to do that while I speak, and I want to give you my full attention. Okay, hopefully that should work. Okay, good morning, everybody. Or if it's not morning in your time zone, then, I hope you're having a lovely day already. My name is Anna. I am an admissions tutor for Medicat. I deal a lot with kind of UCAT, a lot of interviews. I'm responsible for most of strategic applications, and we'll talk a bit more about that later. And I've been doing this for a while now. So I'm the person who's kind of here for the intro bit and here for the Q&A, and I'm going to do some UCAT stuff for you today as well. We've got another speaker joining later as well, who's going to take you through some other parts. But for the main part, you are stuck with me today. I'm always happy to have questions. If you want to send them to me, that's absolutely fine. If they are very specific questions, we'll cover them in the Q&A at the end. But I do really hope that you are going to get something out of this today, whatever stage you're in your current planning. If that is you are doing, UCAT stuff already, some of you might be doing that. If that is that you've not looked at anything yet and you are still at the very early stage where you're just deciding whether to apply, which is also completely fine. This is kind of a good overview, whatever stage you're in. So try and listen, try and take something away from it. And if you do have questions, we've got a Q&A at the end. So please do ask. There are no stupid questions. You are all not at a stage where I expect you to know anything. So just ask if there's a question, okay? So what we'll do today is I'm at the kind of first part of you. So we're going to do the introduction to medical applications. That's just a quick overview of some of the things. Some of them might be surprising to you. Some of them might be obvious to you. You're going to do a bit of other things in between that. So there is your virtual ward round that's up next after me, which I'm sure you're all looking forward to. And then you've got a bit about Oxford applications, which would be very good. We've got a break in the middle so you can have some lunch, and then we're going to come back with UCAT strategies, and we're going to finish up with the Q&A. A bit about who we are. So I'm part of Medicat. Medicat is a team of medical admissions tutors. Just very quick notice, a lot of people are requesting to record this meeting. I cannot give you permission to record the meeting, but the recording will be available from our side. So you will have access to that later on, but I cannot kind of allow you to record that locally, unfortunately. So we're a team of medical admissions tutors. We deal a lot with kind of UCAT, strategic applications, a lot of personal statement stuff around the summer as well. And we do a lot of interview prep, especially in the direction of mock interviews, specific like university-specific interview prep, because every university is slightly different, and some of them are kind of vastly different from each other in terms of how their interviews work. We've got a few Amazon publications, so you can look us up and you can find that we've published some planners, we've published some UCAT books, which are all quite good. And we've got a lot of very, very happy students. And if you look on Trustpilot, and at the end, I think we're going to ask you to leave a review as well if you want. You can look on Trustpilot, and we've got very happy students who've gotten into medical school with us, which is always really lovely to see. The bird's eye view of medical applications is very, very broad. You've got your GCSEs, you've got your A-levels, you've got your work experience, and that's kind of one part of it. The work experience doesn't feed into it quite as much unless there's one or two universities where it might feature. And then you've got your UCAT, your personal statement. That's the next part. So your personal statement, your work experience is inherently linked. But your UCAT is one part that is very, very difficult to balance out if you don't get it right. So if you take anything away from today, please let it be the fact that the UCAT isn't just something that you just have to do. That's like, it's kind of like a thing that you just have to sit and it doesn't really matter. The UCAT is probably the most important exam you will ever sit if you're trying to get into medical school. It is not, an impossible exam by any standards. It's something that you can prepare for very well. It's very possible to learn things about the UCAT and how to learn strategies and everything. We'll go through some of that later on, but it isn't an exam that should be taken lightly by any means. Your personal statements we'll talk about in a second as well. And then tomorrow you're going to talk about some interviews and scenarios as well with Annabelle, which should be really nice. But that's kind of your bird's eye view. That's what goes into your medical application. And some of these parts are easier or kind of less important, and some of them are more important. And we'll go through some of that right now as well. When it comes to GCSEs and A-levels, the most important thing is to just have the grades that you need, right? That seems very obvious, but that will differ by university. Always look up if you have the grades. If you're an international student, email the university, get it in writing that your grades fit their framework for what kind of grades you need. The majority of medical schools will require you to have maths, English, sciences, at least grade 5 and 6. Science is usually a grade 6 or 7. And then you have your English. English is usually the requirement is a grade 5. However, some universities will score your GCSEs. That means beyond the minimum requirement, you will get points if you have high GCSE grades in certain subjects or just overall. That's not few schools. That's actually quite a lot of the schools. So keep in mind that for some subjects like English language will almost always be scored. Maths will almost always be scored. For many schools, you can resit a GCSE, especially English. So if you have a grade in English that you think would not qualify you to apply to medical school, the safe option is to resit your English language GCSE. It is often a lot easier than trying to have to battle with schools about, if you have a grade 4 in English language, for example, or if you really, like your dream school is a school that needs you to have a 7 in English language, which is rare, but can happen, then maybe the better option is to think about resitting it. You should really be aiming for kind of 7s, 8s, and 9s for your GCSEs. I know most of you will have sat your GCSEs, so this is kind of a bit of a mute statement, but the general kind of aim is 7s, 8s, and 9s. The higher your grades at GCSE, the easier it gets. But there are very few schools that you can go to just because you have high GCSEs. It's part of the scoring, but there is only one medical school where it's basically all of the scoring. Okay. Then your A-levels. And again, most of you will already have started your A-levels. You'll be halfway through your first year. That's really good. I will honestly say I'm in my 4th year of medical school now. I kind of miss my A-levels, so enjoy the time. It's really nice to do different subjects as well. The majority of your medical schools will need you to do chemistry. And I think for people, it's quite surprising because often you think that they need you to do biology. Some of them will. Some of them require you to do chemistry and biology, but most of them will require you to do chemistry plus another science A-level. And science A-levels usually are counted as biology, physics, or maths. They're kind of on the fence about maths, to be honest, some of the schools, but generally speaking, one of those 3 and chemistry. But that will differ by school. Always check with your schools. It's always on the website. You can always just look it up. Not all want biology, but it is your safest bet to essentially be chemistry, biology, plus another subject. You are not disadvantaged if you do not do maths. There is no school where doing maths is essential. For Oxbridge applications, often it's recommended that you do 3 sciences or 4 sciences. Again, there are people who have applied to Oxbridge who've gotten in with less sciences than 3. It is up to you. Again, for most of you, this will already kind of be a decision that you have made, but don't think that you can't go to medical school because you don't do biology, chemistry, maths. I did biology, chemistry, physics. I really enjoyed physics. It was a great choice for me. It helped me in medicine even. So, it's not about doing maths necessarily. If you do not have the grades, if you do not have the GCSE or the A-level requirements, especially if this is like far below the threshold, then look at foundation programs. Many of them will require you to be a widening participation applicant. That means coming from an area with low participation, secondary or tertiary education, looking at kind of deprivation in your area, if your parents haven't gone to university, if you've been in local authority care, anything like that will usually qualify you for a foundation program. Those foundation programs are really good. They allow you to go on directly to a medical degree, but they are competitive as well. But if you do not meet the GCSE or A-level requirements, that's something to have a look at. Often there is kind of a threshold of how high your grades can be before you can apply. So you cannot have 3 A's, for example, because it would qualify you to apply for medical school in the traditional route. But it is something that is open to people who don't meet the traditional grade requirements. And one of my students got her offer for her foundation program on Wednesday. And she is over the moon because she applied the year before and she didn't get her grades. And she's now going to medical school and she's got 3 B's at A-level and her GCSEs aren't amazing because she went to a school that didn't have very high achievement in secondary education. They were not a very good school, essentially. And now she can still go to medical school because she's very smart and she put a lot of work into it. So it's not the end of everything, but it does kind of put a stone in your path that you have to learn how to navigate. It's all about strategically applying. It's not about, this is this university that I like and this is the university that I've looked at, I think I would also like to go to. That's great. You should want to go to the universities that you apply to. Don't apply to places you don't want to go. But it is important to be strategic in how you apply. We'll talk a bit more about this later. I see you all have questions. I'll answer them at the end just so we can get through everything, okay? Work experience is something that people find really challenging to get. Keep in mind that since COVID, you can try to find it online as well. Lots of programs now offer an online option. That is fine as well. It is not about what you do. It is about what you've gotten out of it, essentially. Are you participating? Is this something that you've made notes of, that you've reflected on? That's what they want from your work experience. That's what universities want from your work experience, and admissions tutors and the people who are interviewing you, that's what they want to see. It is important for your own sake to do work experience and to realize that work experience allows you to see if this is the right job for you. It is not a formality. It is something that should allow you to have a look at medicine as a whole and decide, is this something I want to do, or is this something that I would rather just not do? And that's perfectly fine. You can change your mind. I've had students who went on to work experience and said, actually, I don't want to do medicine because the job isn't what I thought it was. That's the point of work experience, right? That's the point, because otherwise you start doing a degree that you don't want to do. So do the work experience, be it online, be it in person, the volunteering, even if you can just speak to medical students and doctors about medicine and kind of get an idea if you would like this, that's still really, really good. Try and do that. But whatever you do, keep notes on it and reflect on it because it will be very important later on in your application process. The UCAT. And the UCAT is, so I deal a lot with kind of UCAT questions with admissions prep for the UCAT. So this is kind of my area of expertise. And the UCAT is now more important than ever because there is no more BMAT. And for those of you who do know what the BMAT is, great. For those of you who don't know what the BMAT is, you don't need to worry about it because the BMAT as of this year no longer exists. It was a different admissions test you could do for medicine for some universities. It's gone now. It's not going to be happening this year. And so the UCAT is more important than ever. You can only sit the UCAT once per admission cycle. And that means that your sitting of the UCAT should be your best work, essentially. You should be sitting the UCAT when you're confident that this is the best that you can do overall, right? This is the best that you can do and you've put everything into it. One part that's really important in this, and again, I'm quite insistent on this with my students, if any of you know me, then you'll know this, is booking a UCAT date that actually fits you, because sometimes people book UCAT dates just around when they're going on holiday, just after their birthday. You're not going to be revising during that time. So try and book a UCAT date that fits for you. There's no magical date, but people do better And statistics show this. This is not just my personal opinion. Do better when they sit it in the summer because you have more time to revise. And when you're sitting it in September, then you're back at school and you've got other things to worry about as well. Year 13 is very, very stressful. So unless you are reapplying as a gap year student, I would recommend that you sit the UCAT in the summer. Okay. So UCAT booking opens on the 18th of June this year. You can register before that. So that means you can sign up on the website to have an account, but then the booking only opens in June. And then you can pick a UCAT date, and that's the date when you will sit the test. We'll talk more about the UCAT and how to prepare for it later. And that's my part, and I'll come back at around 12:30-ish to talk about that. But the UCAT runs from the 8th of July to the 26th of September. This is just something that, this is your test period, right? You can't sit it outside of that. It's just, you have to pick a date within that period. There's no exemptions from this, and there's no exemptions from the UCAT. You have to sit it. Medical schools will not consider you unless you sit the UCAT. Very occasionally, if you have very big extenuating circumstances, for example, if you're currently in a war zone or anything like that, they may give you an exemption, but that's pretty much the only reason why you wouldn't be sitting the UCAT. Everything else, you have to sit it. It's not a question. Your personal statement. Personal statements are a vastly debated topic. Not all universities will read them, but the ones that do read it often use it at interview, and even the ones that don't read it before interview may use it at interview to ask you questions about it. So do put the work into it. There was a lot of discussion about the personal statement, if it will be replaced by questions, but this for right now will stand as it is. You have to write 4,000 characters. There's a certain number of lines that this can be. And this is really about your personal journey to university and to medicine. There is a lot of things to keep in mind for your personal statement, but your personal statement really should be about you, what you have done. It should be reflective. It should be including all these experiences that you've had, your work experience, your wider reading, prizes you've won, if you've won any prizes, your hobbies, your interests outside of medical school, volunteering you've done, other experiences that have led you to medicine. I would recommend you keep a list of everything you would ideally want to include in your personal statement and then go from there. That's usually the easiest way to do it, in my experience. It does take a while to write, so do make sure that you give yourself enough time. Your personal statement is due at the UCAS deadline in October, and that means that you should ideally start writing it in the summer. And you make a list of everything, you write the first draft, you get it looked over by people, you come back, you make corrections, you ask your teachers, you ask anybody else that you think you can ask us. And all of these things will make a good personal statement at the end of this. But your first draft is just that. It's a first draft. Start writing it in the summer and then go from there. It takes a lot of stress off of you if you've got your personal statement ready by kind of mid-September. You can still add to it then. You can still make changes, but it's not as stressful if you are not trying to rush through everything in the last month. Interviews. Your interviews usually are either MMI interviews or panel interviews. An MMI is a multiple mini interview. That means you have multiple very small interviews. So you have what we call stations. And a station is just one interviewer who asks you a question and you answer that question and you have a certain amount of time to answer it. Usually this is around 5 minutes or 6 minutes. So you go into your station, they ask you a question, you answer the question, you move on to the next station where the same thing happens again. Usually there is between 5 and 10 stations or 12 stations at most, and you answer a question each of them. Sometimes you answer multiple questions. So all of this really feeds into whether you get an offer. So your MMIs or your panel interviews, which I'll get to in a second, are really important to prepare for. Your panel is slightly different, and there's very few universities that still use this, but there are still some. Oxbridge, for example, use panel interviews. Glasgow uses panel interviews. And usually the way that this works is you have you, and then you have 2 interviewers. There might be 1 or 2 panels or 3 panels at most. And you get asked a question and you answer your question, and usually you get asked follow-up questions based on this. MMIs don't usually do that, so that's the main difference. Whether you are going to be an MMI or a panel interview depends on the universities you apply to. So if you apply to a panel university, then you will have a panel interview. That's just how it is. Both have advantages and disadvantages. I think panels are really nice. Some people really prefer MMIs because people say they're less biased. It's entirely up to the person what they prefer, but unfortunately, you cannot choose. Some universities will also run their interviews online or partially online. That's the same as being in person, except that you don't have to go there. And for some people, that's really good, especially if you would have to travel quite far. For some people, it's not so great because you like to see the university. So especially if you know that the university is likely to interview online, always make sure that you are going to the open days, that you're visiting the universities, so you still get a chance to see them. Offers. Now, once you've done all of this, once you've done your UCAT, your personal statement, your interview, and everything has gone well, you will get your offers for medical school. Now, the important part is to continue working hard on your A-levels, because your offer alone will not get you into medical school if you don't get your grades. Unless you have achieved grades, you will be given what is called a conditional offer. Conditional offers are offers that are still not finalized in a sense. You still need to achieve the grades that they've given you, usually 3 A's or A star AA, in order to get into medical school, in order for them to give you the place. Every single year, lots of students miss their offers. So don't be that person. Try and still put all the work in, even if you've already got your offer, because it is still conditional on you achieving the grades. The other piece of advice here is to keep away from the student room during this period, because this is very stressful and everybody gets very, very hectic and everybody looks for advice. But sometimes what you see isn't the most representative of what everybody is doing. So try and ignore the noise, try and focus on your work, and just try and make sure to do lots of past papers, to seek help when you need it, and to try and work on your A-levels and just ignore the rest of it for a bit. If things don't go the way that you want, then you might end up taking a gap year. Now, lots of my students have taken gap years, and in my experience, gap year students do extremely well. We have thousands of students that take gap years, and this is not a disadvantage to you if you reapply in the next year. Often gap year students do better than students who apply straight out of school, not always, but very often. And this is something to really consider, especially if you want to break in between finishing school and going to medical school. You can also just choose to take a gap year and just say, I'm not going to apply this year, or I might apply, but only for practice. And then next year, I will put all the work into it and I will actually do the whole application properly. I will put 100% into it. That's also possible. It depends on you, and you can use your gap year as you want. But medical schools want to see that you've done something during your gap year, be that you've had a job, that you've traveled, that you've volunteered, that you've taken care of a relative, anything. That's perfectly fine, as long as you've done something, okay? Also use this year to kind of reflect on your previous application if you've already applied. Medical schools really want to know that you can learn from what you've done so far. So if you are a reapplicant, tell them about that. Tell them, this is what I've learned from last year. This is what I will do differently this time. And here is why I think I wasn't successful. And this is what this has taught me for medical school in the future. We're going to have a very brief look at what it means to strategically apply to universities. Now, I'm going to show you two different made-up people in this case, who are applying with pretty much exactly the same grades and the same UCAT score. And both have very different outcomes because of where they chose to apply. So our first person is Anthony, and Anthony is 17 years old. He's predicted A star AA in his A-levels, which are very good grades. And he's got 8 GCSEs, 2 7s, 5 6s, and 1 5. He scored 2,650 in his UCAT. For those of you who don't know anything about the UCAT, that's slightly above average. It's a good UCAT score, but not a great UCAT score. He decided to apply to Queen Mary's, to Bristol, Cambridge, and Manchester. Now, for Anthony, that probably didn't go very well because all of those universities are very UCAT heavy. Bristol needs a very high UCAT score. We're talking more in the direction of 3,000, like 2,900. So that would have not been an interview. Queen Mary is the same. So they're quite heavy on the UCAT scoring and the pretty great scoring. So again, that probably wouldn't work out to be an interview. Cambridge, we don't know yet for this year what they'll do in terms of their required UCAT score. But this is probably not enough for a Cambridge interview because it's just above average. In Manchester as well, they rank people by their UCAT score. So because he's not in kind of the top kind of 10%, this might work out to be, again, not an interview. So for him, that might end up being 4 rejections pre-interview, because all of those universities are really heavy on their UCAT scoring, and his UCAT score is not good enough, essentially, to apply to these universities. Now, our other person is Sabrina, and Sabrina is 17, and she's applying with the same grades and the same UCAT score. But she's decided to apply to Keele, to Plymouth, to St. George's, and Kent and Medway. Now, for those universities, Keele scores very heavily on your personal statement. They look at what you've done to prepare for medicine, your work experience, your volunteering, if you've done courses outside of your kind of usual schooling, if you've done anything else, like been a carer. So for her, if she's done any of these things, then that's probably a really good university to apply to. They don't look at your UCAT very heavily. They don't look at your GCSEs very heavily. So that might be a very good choice. Plymouth as well usually has a lower UCAT requirement, so probably a very good choice. St. George's, so their cutoff score is usually just around 2,650, might be slightly higher, might be slightly lower, but could work out very well for her. And Kent and Medway has a very holistic application process that might allow her to balance out her UCAT with her predicted grades, for example, or her GCSEs. So in this case, Sabrina likely will end up with 4 interviews. And that's a very different outcome with exactly the same grades and exactly the same UCAT score. It's not about having a perfect application. Very few people will have a perfect application, but you do have to cater to your own strengths. Okay. I'm going to take questions now. I know I've got lots of them in the chat, so I'm going to have a quick look there. And then I will hand over to the next person. Okay. Is it hard to write a personal statement for medicine courses and one finance and maths course? So you will not be able to write a personal statement that's both for medicine and finance and maths. That will not work, because your medicine personal statement needs to be only for medicine, and it needs to be very focused on medicine. So if your 5th choice is a finance and maths course, ask them if you are able to submit a different personal statement. That's the only thing you can do, because you will not be able to write a personal statement that fits both. Is today's session the same as tomorrow? No, it's not. It's a different session. Does psychology count as a science? It depends on the university. I can't tell you, because some universities say yes, it does count, and some say it doesn't. So check the university websites. I heard that people with A stars in their A levels have been rejected from medical school. If that's the case, then can you apply for foundation years? No, you cannot usually apply for foundation years with A stars, or A's for that matter. The reason they've been rejected very likely is either because they don't meet the GCSE requirement, or because they've got a low UCAT score. So if you've got a low UCAT score, you can reapply the next year and you can sit the UCAT again. That's kind of your option. But you can very much get rejected with A stars in your A levels if you don't have a good UCAT score. The UCAT is very, very important. Do applicants with extra time also get extra time in the UCAT? Yes, you do, but you have to apply for it. How do I apply for access arrangements for the UCAT? You can find that on the website for the UCAT. If you go on the website and you look up access arrangements, then you will find that there are lots of links that you can follow. There's a deadline to apply for that as well, but just have a look and you'll be able to find it quite easily on the UCAT website. Will all unis that use BMAT now use UCAT instead? Almost all of them have confirmed that. We've not heard back from Oxford as of last night. So we don't know for Oxford yet, but everything else, including Cambridge, yes, they will be using the UCAT. The conference ends at 2 p.m. today, and then it goes on tomorrow. What about UCAT prep resources, especially for international students? There are some very good resources. I'll go into that later when I do the UCAT session. Is it true that if you've applied and you didn't get in and took a gap year and reapplied the next year, some universities wouldn't accept your application because you've been rejected before? So It depends. Most universities will accept you if you reapply. It depends when you've been rejected. So there are a handful of universities that won't accept you if you've been rejected post-interview. So if you've had the interview and an interview decided against you, then sometimes they won't let you reapply. But there are a lot of medical schools, so it wouldn't limit you very much. If you've been rejected from 4 universities, can you apply again in the same year for different courses or not? No, not usually. You can apply through clearing if you want. That usually is something that you can do, but there aren't many medical courses in clearing usually. There's usually about 5 spaces, 10 spaces at most. The UCAT is set in testing centers. Okay, I'm going to leave the questions for now. We have a Q&A at the end because lots of these questions aren't actually about what I've covered so far. So I'm going to let them here, like I'm going to leave them here for now. You can put them in here. That's absolutely fine. I'll cover them at the end in the Q&A. Okay. I'm going to hand over to Sophia now, who's going to take you through the next part of this. I'm going to stop sharing my screen and hopefully we'll be moving on.
Yes, hi everyone, I'm Sophia. I'm a 5th year medical student at Manchester who actually finished their last clinical placement on Friday. So I'm quite sad and I kind of actually wish I was starting all over again from first year. And I think that this conference is going to be absolutely fantastic for you guys to kind of gain all the necessary information you need to apply successfully. And also, I think after my talk, make you feel a little bit more clinical and think more clinically so that you're ready to answer some more kind of medicine related questions in your interview as well. So let's begin. Let me share my screen. Okay. Brilliant. Can we all see that? Yeah. Anna, can you see that?
Yes.
Brilliant. Okay, so let's begin then. This kind of session is going to be a virtual ward round. And in particular, we're going to be on a cardiology ward, so looking after people's hearts. And we're going to begin thinking about what you would do the minute you walked in to work. Okay, we're all doctors now. This will be me in kind of 4 months' time, which is really scary. But what's the first thing you'd want to do when you got to work? Let's say you'd been on holiday for a week. You don't know any of the patients. What does anyone think you'd want to do? Any ideas? You can unmute yourself, you can put them in the comments. I want this to be as interactive as possible so you can get kind of a real experience of how these things work. Yeah, introduce yourself, get to know the patients. And somebody's put attend a handover. And that's the first thing we're going to do. So just as a little clarification, today we're going to be kind of understanding the structure of the ward, understanding kind of key events that happen throughout the day. So a handover being the first thing you do, and we'll talk about what that is in a minute. We'll be talking about the structure of a ward round and what that means. We're going to be thinking about how we actually manage a patient, okay, and understanding who is around you to help you, not just the doctors, but who else is around. Then we're going to be doing some interactive cases, which is great. It's also good revision for me. So, handover. It starts at around 8 o'clock in the morning on a medical ward. If it's a surgical ward, sometimes it can start a bit earlier, but the doctors usually start about 8 a.m. The nursing handover tends to start before the doctor's handover. So the nurses have a separate one and then the doctors have a separate one. And in some places they have a combined one. And one of those places where they have a combined one is usually kind of a geriatrics ward. So looking after the elderly. And that's because that specialty is multifactorial and it needs lots of members of different specialties. So a multidisciplinary team to come and care for patients really well. So they tend to have a combined one. So it happens in the morning and it happens in the evening as well, because you have to remember that there's an evening team on the hospital as well. We can't just leave patients alone in a hospital overnight. And we all sit there, we all talk about the shift we've just had, and we get to kind of get information about any new patients that have come in, or any changes to patients' health, or any outstanding tasks that you might have to do. So, the kind of tasks that you might have to do starting your shift in the morning might be to look at people's bloods. Have people had any bloods overnight that need checking in the morning? Have people had any scan results? Have kind of people deteriorated overnight and you need to review them in the morning with kind of a senior doctor? All those things they might give you as tasks to do. Okay. So now you've been given a handover, you've been introduced to all the new patients on the ward, and you're going to start a ward round. Does anybody know what a ward round is? Anyone? You go with each patient, yeah, it's kind of self-explanatory, isn't it? Exactly. And I tried to work out earlier how many ward rounds approximately I've probably been on over these last 6 years, because I intercalated for 5 years. And I was thinking, if on average you're at medical school for like 9 months of the year, I was thinking I've probably been on like 300, 400 ward rounds over my time. So that's a lot of ward rounds. And as you kind of progress through the years, you get a little bit more involved in the ward rounds. But first, you're pretty much just a number, and you're there kind of following all the doctors around, kind of trying to avoid eye contact so that they don't ask you any questions. Okay. So, yeah, we're completely right. We're going seeing every single patient. It's usually once a day. Some wards do twice a day if there's really unwell people. So thinking about people in intensive care units, sometimes they have a ward round twice a day to kind of see how people are progressing, because really sick people tend to change very quickly, and that's why it's important to review them regularly. And you also kind of split into teams. Your average ward might have 25 people on, 30 people on, and it's more efficient to split. So sometimes you kind of have two teams that go around at the same time, and your aim is to see all the patients. So your job as kind of a doctor at this point, as a junior doctor in particular, a foundation doctor, is to prepare the notes. Now, all hospitals have obviously documentation, but the difference is it paper documentation or is it online? And I've been lucky to experience both, because in Manchester, the Central Hospital in Manchester, only recently in 2022 changed to online records, which is crazy to think that before we were writing everything down still. And a lot of hospitals still have paper notes. And they're quite tedious, and they can get quite bulky if people are there for months on end. But before every ward round, you want to make sure that you have everybody's blood results in front of you, kind of any updates that they've had over the last few days, any plans that were put in place the previous day, whether those have been met. And you need to make sure that that looks all nice and clear for today's note or today's ward round, to see what the patient is doing and how they're progressing. Okay. Another really important thing is to have their observations. So does anybody know what we mean by observations? And it's not just like kind of looking at what the patient's wearing or kind of what their hair color is. Yeah. Good. Yeah. Heart rate, respiratory rate, so how many breaths they're taking, blood pressure, temperature, oxygen levels, and blood pressure. Okay, those are the main few. So you want to know those. And we'll talk about why we can use those as an indication to how somebody's doing in a bit. And then we've got results, so any blood tests they've done or any scans and any previous plans, as I said before. And then going to start going around each patient. It's usually led by a consultant. You usually have a junior doctor, you might have a nurse with you, or a physiotherapist or certain wards, and then kind of you, the medical student or the work experience student in this case, okay? And you're going to go to the patient and you're going to do a consultation. Now, this usually involves a quick history, you know, how are you doing? How are your symptoms? Have you got any pain? You might examine them, you know, listen to their lungs or feel their tummies, or kind of, you know, ask them to walk, things like that. And then you're going to plan. You're going to plan what needs to happen next for that patient to improve. Okay. And that might be having another scan done or having some more blood tests. And those jobs are all to be done by the junior doctor. That's what their role is. So let's move on. These are the members of the team, as I said. Now, the aim of most hospitals is to get people home very quickly, because as we all know, the NHS has, you know, struggling recently quite a bit, and we've got lots of patients coming in and not enough going out, and there tends to be a little bit of a backlog with beds. So a really important discussion to make is, can people go home? Are they well enough to go home? And we tend to categorise patients based on this. So are they fit and well and they're ready for discharge, in which case we can refer them onto the discharge team. So in hospital, you have a whole separate team that deals with the discharges, and people tend to go to another specific area of the hospital to kind of get some documents, get their belongings, and then they can kind of go home and make sure we've arranged some transport for them if they need it. Or we might categorise patients as they're doing better, but they do still need some care. So maybe they need, you know, to finish their antibiotic course, or maybe they kind of just are waiting for one more scan to be done just to make sure we've covered everything. And then we can categorise them as well, but we need to, again, continue to monitor them. Yeah, just make sure that they're doing well for a few days before we can let them go home. Or they can be unwell and still need to be treated, or they can be acutely unwell. So right this second, they are really unwell and we need a new plan, and we need to start over, and we need to rethink about what's going wrong with this patient and how we can help them. Good. So next, let's talk about how we use our observation skills, our knowledge, our examination skills to look after a patient. The first thing I want to introduce you guys to is the NEWS score. So this NEWS score is a score that we use, and we take kind of all those observations that we talked about before: heart rate, kind of blood pressure, oxygen saturations, and we give them a score, and we use that score to see how well they are. Okay, and we'll talk about that more in a moment. The other things we're going to do is look at their notes, look through all of their history. We can also access kind of GP records as well. So we can log into a system and look at kind of the regular medications they were on, previous maybe surgeries they've had, previous illnesses they've had. We're going to take a brief history from a patient, but we're also going to perform what we call the ABCDE assessment. So when someone's extremely unwell and you're panicking and you don't know what to do, it's important to follow a structure, okay? And I've been practicing these assessments non-stop over the last few weeks because my exams are in 2 weeks' time, and I know that one of the stations is an ABCDE assessment where somebody's going to be really, really unwell, and I have to diagnose the management all on my own, and that's quite a lot of responsibility. So following the structure is really useful. And we'll talk about what that ABCDE approach is in a moment. Brilliant. So we've said we'd look at the medications, see what medications they're on, see if any of their medications are kind of maybe even interacting. Yeah. And then we might also ask a senior to come along and help us. Okay, so the National Early Warning Score, the news score. So the higher the news score is, the more abnormal the observations are and the faster we need to act. And they're an excellent way to tell us somebody is deteriorating. And if I was looking at kind of a hospital system right now and I brought somebody's news score, there's like little arrows to say, oh, is this person, heading in the wrong direction, or are their news scores coming down and they're getting better? But of course, it's important to remember that sometimes people can be really unwell, but their observations are still normal. Does anyone know what kind of patients that might be in, where their observations might be normal, but they're actually quite unwell? Any particular age group of people? Let's go to there. Young. Yeah, young teens, absolutely. Yeah. Children tend to compensate really well when they're poorly. So they might, be really unwell, but their observations are pretty normal. And in children, we have a pediatric early warning score, because your heart rate and heart rate of a baby is very different. So obviously we have to adjust those parameters based on how old the person is, whether they're a child or whether they're an adult. Okay. But yeah, children tend to compensate really well, and young people. Good. So let's look at a chart of this news score then. This is quite, we try to fit in as much of it as possible. But as you can see, it's kind of this colourful chart. It has the person's name in the top left corner, John Smith, and kind of his date of birth and the kind of the gender. And then it has the days that these scores have been recorded and the times that they have been recorded. And this is really important. Knowing the time of day is vital, because if it's somebody really elderly and they tend to kind of stand up in the morning and their blood pressure drops because they've stood up too quickly, it's important to know kind of what time of day that is and things like that. And as you can see, there's all the different parameters. So we've got respirations first, so breathing rate, and in white is the normal range. Okay, so this says that between 12 breaths and 20 breaths is pretty normal, and then the yellow and the orange is escalating a little bit. This person might be breathing too much or too little, and then the red is kind of the more dangerous areas. And then we've got oxygen, so we can see that the oxygen's coming up and down on this patient. Yeah, again, the normal kind of being over 96 in white. However, we tend to say that anything over 94 is acceptable. And then we've got kind of oxygen levels. How much oxygen are we giving this patient? Are we giving them oxygen from a mask, or are they just breathing on room air? Okay, so if it's A, it's room air. Then we've got blood pressure. Again, blood pressure being kind of systolic on this one. So the force of your heart when it's contracting. And that can be anywhere between kind of 120 over 70. I don't know if anyone has ever heard of how you kind of measure blood pressure, but the top number is your systolic and your bottom number is your diastolic. Okay, and that's kind of measuring that. We've got pulse rate. Yeah, so kind of how fast this person's heart going. This person's is a little bit on the high side. So I'd say normal is between 60 and 100. This person is constantly at that 100 range. Are they conscious? So we kind of tend to say, are people alert? Are they confused? Or kind of are they unconscious as a general rule of thumb? And then we have temperature as well. And as you can see, you add up how many kind of boxes of orange or red or kind of red they are scoring, and you give them an overall score. And then luckily for us, the score is also kind of highlighted in white, red, or orange to indicate how unwell that person is. Brilliant. So let's move on. These are the thresholds then. So if I was picking up the phone in the middle of the night and one of my nursing colleagues said, "Oh, hi, Mr. John Smith is scoring a 7 on a new score. They've become really, really unwell," I would be running to that patient. However, there is one instance where I wouldn't be running to that patient, and it would be if they have been a 7 over the last week all the time. So they've been in like high dependency unit, they've been really unwell constantly. Well, that's the normal for them at the moment, and we've got plans in place to deal with that. So that's the only time really that you wouldn't straight away go, and that comes from experience, that you know how to do that, and also the experience of all your colleagues. If the nurse is calling you and saying this is something different, then of course you have to go. Okay. Then we have medium, so you'd go to them pretty fast, and then you'd have low and medium, and you would kind of see them if you were on that ward. But if you were dealing with a patient somewhere else, you wouldn't necessarily go to them till later if you've got more unwell patients. But if you've got nothing to do, well, of course, they're your top priority. Okay. Does anyone have any questions about news before we move on? I think this is a really interesting point to show, during your interview that you know how we assess patients in hospital. You can say how you've seen news being used to kind of categorize people based on how unwell they are. Someone is asked, how often do you carry out this assessment? The nurses do it constantly. So the nurses do observations, kind of maybe once a day, twice a day, 3 times a day, depending on how unwell a patient is. Some people even get hourly observations, and it automatically calculates that new score. A lot of online systems now in the hospital. Okay. Do doctors calculate it, or do nurses? It's usually our nursing colleagues that do that for us. Good. And is this carried out during a ward round? No, but we use it during the ward round. Okay. So this assessment is, if it's an online system, it just happens automatically kind of online. They input the observations and the observations are put into this system. If it was still manual, then you'd kind of have to put it in this chart that you saw before, and then kind of use that chart to work out kind of what their new score is. And then during ward round, we'd look at their new score and think, oh, well, they're actually starting to go up in the new score, so they're becoming more unwell. Maybe we need to change our assessment. Okay. Somebody's put the news assessment seems good for determining clinical need, but it doesn't look at everything. Yeah, absolutely, it doesn't look at everything. It's just an indication as to whether we need to do more things for that patient. Yeah. Good. So let's move on then. I might come back to some questions at the end. So we've looked at the new score. This patient is doing kind of quite unwell. How are we going to get to know them? I think this is pretty kind of self-explanatory. We're going to speak to them directly, get a good history. But what if somebody's got kind of that's quite unconscious, or maybe they've got dementia? We need to ask their family members or their next of kin that have legal right to have input into their decisions. Okay, that's really important, making sure that they have been given permission to speak on that patient's behalf, for example. And we need to get maybe a history from them as well. And we also need to get a history from our nursing colleagues that are with them constantly. Okay. As a doctor, you're often leaving the ward, you're going to different places. If you're on call, you're just never on the ward that you're on during the day. You can be anywhere in the hospital looking after other patients. And who's going to know the patients the most? Well, it's your nursing colleagues that go see them multiple times a day. So ask them how they're doing as well. Okay. So then we're going to talk a little bit about an ABCDE assessment. Okay. So luckily it stands for what it is. So A stands for airway, B stands for breathing, C for circulation, D for disability, and E for exposure. And they're in that order based on how fast they can kill you, pretty much. Okay. If somebody's airway isn't open, it's closed, and they're getting no air in, that's going to kill you very fast because the lack of oxygen is going to do lots of damage. Okay. So that's why the first thing we assess is the airway. And the easiest thing to do is, hello, hi, how are you doing today? Just ask them how they are. And if they can speak back to you, that's a really good sign that their airway is fine. But let's think about if somebody's having kind of an allergic reaction. So I know my friend's allergic to peanuts. If she'd ate a peanut, she's going to have an allergic reaction. And what tends to happen is everything starts to swell, okay? And their airway might start to swell and it gets smaller and smaller, okay? So when you're doing an airway assessment, look for any kind of changes to their voice. Look for maybe any signs in their face that is showing that somebody's getting really unwell. Maybe they're swelling up, or maybe some kind of unusual sounds coming from their voice. Maybe they've kind of swallowed a foreign object. Okay. When I was on my A&E placement in Wrexham in Wales, I had a child with like a bead in their, it was quite a large bead actually, it was quite one of those like necklace beads in their throat, which luckily allowed a bit of air in, but it was almost like a whistling noise. So yeah, looking for extra sounds that don't seem normal is also really important for assessing the airway. Okay. Then we look at breathing. So we look at their respiratory rate. So how fast are they breathing, or how slow are they breathing? So if they're breathing quite fast, that means their body is trying to fight and get more oxygen, doesn't it? So that can be worrying. Maybe they've got an infection, or maybe they've got asthma, things like that. Then we look at their oxygen saturation. So how well is that oxygen moving around their body? And I'm sure you might have seen kind of the probes that we put on people's fingers to measure the oxygen saturation. We look at their chest wall movement. So is their chest moving nice and equally and with every breath? Because if somebody's got maybe a collapsed lung, a lung that isn't fully expanded and working well, their chest wall might move kind of a bit higher on one side than the other, and that's something important you need to look at. And then we're going to listen with our little stethoscopes onto the patient's chest, and listen for their breath sounds. If it sounds a bit muddled, a bit crackly, that indicates to us it might be an infection, something like that. And then we move on to C, where we look at the heart rate of somebody or their blood pressure. Okay, we look at their skin color. So if somebody tends to look a bit more pale than usual or blue, that might mean they're not getting kind of enough oxygen around their body. We also look kind of under their eyelids, their bottom eyelids. I won't pull them down. I won't pull mine down for you all today. But you look under in their lower eyelids and see whether it looks a bit pale. That might be an indication of things like anemia. Yeah. Or if their lips are a bit blue, that just means they're not getting enough oxygen. Okay. We look if they're clammy or sweaty. Yeah, when people are really unwell, of course, they become very sweaty and clammy. And during things like heart attacks, people can become very clammy and sweaty as well. And then we listen to their hearts. And listening to their hearts is a skill that kind of you build upon throughout medical school, but I think you build upon throughout your career, because I can tell you now, after kind of 6 years, listening to heart sounds is probably one of the hardest things to do. And I don't know if anyone else agrees. Anna, I don't know if you agree, but listening to heart sounds is kind of really scary. So yeah. And then we move on to disability. Now, what this indicates is kind of somebody's alertness. And we use what we call the AVPU score. What you quickly realize about medicine is it's all about scorings. It's all about kind of acronyms for things. and they're useful. So the AVPU stands for alert, response to voice, response to pain, or is unconscious. And obviously, as you move along, it gets worse and worse and worse. So yeah, that's a really good measure to see how alert somebody is. Then in disability, we look at somebody's blood sugar levels as well. See if they're too high or too low. That might be affecting the way they're behaving. And we also look at their pupils. Okay, look at their eyes, shine light in their eyes. Are they equal? Are they small? Are they big? Do they react to light? Okay, all those things are really important for assessing pretty much what's going on up here, what's going on in their brain. Okay, so certain medications such as morphine might make, if you've had an overdose of morphine, you've had too much painkillers, your pupils might become really, really small. That's an indication that, oh my gosh, we might need to intervene here and give somebody kind of an antidote, or kind of tamper down their morphine dose. And then E is for exposure, okay? The number of times where somebody is really unwell and you're thinking, why is their blood pressure plummeting? Okay, you know, I keep giving them all these fluids to bring up their blood pressure, and they're still really unwell. And then you expose them, and you think, oh my gosh, yeah, that's why they're losing blood from an injury, and I've not identified that. Okay, so making sure you expose them fully, look for any rashes, look for any injuries, any broken bones, everything like that is really important to do at the end. Okay, brilliant. Let's do some cases then. Yeah, we've still got time. Is there any questions before we just quickly begin? How do fluids raise blood pressure? Oh, good point. So your blood pressure is, well, how much pressure is exerted on the arteries and veins in your body, isn't it? And that's all to do with the volume you have. So if you're losing blood, if you're losing volume, then there's not as much volume to push on the outside of the blood vessels, okay? So your blood pressure drops. So if you give somebody some fluids, and I don't mean, if they're unwell, I don't mean giving them kind of jugs of fruit juice to chug. I mean like putting a needle into their arm and giving them some fluids via their veins. You're increasing the volume, you're going to increase the pressure. So that's how that works. Oh, and Anna's put some heart sounds in. Yeah, that'll be good for me. Thank you, Anna. I'll go in and listen to those before my exams. Yeah, brilliant. Good. Let's move on then. So, this interactive case. A patient is 75-year-old male, admitted with heart failure, with a news of 10. Oh no. When was that? Sorry, I've got all you guys on my screen. And he was a 2 hour, no, he was a 2 an hour ago. Brilliant. And he is struggling to breathe. Okay. So a news of 10, that's pretty worrying. So my first question to you guys is there any more information you would like before going in? What do we think? Is there any information you want about this person before you go in? A history? Yeah, history of breathing problems. Yeah, what medications he's on. Brilliant. Yeah. Fantastic. Why was he a 2? Any variables that could be affecting his breathing? Okay. Yeah, some really good points here, guys. And I'd encourage you all to go through them and read them yourselves in the comments as well. Allergies, really important. Yes, good. Fantastic. Some really good points. Smoking history, yeah, absolutely. So when we're thinking about somebody's history, we think about kind of what's currently going wrong with them, what past medical history do they have, what medications are they on, do they have any allergies? We look at their family history, we look at their social history. Where do they live? Who do they live with? What do they do for work? Do they smoke? Do they drink alcohol? Do they take illicit drugs? All those things are really important to ask. Really good, guys. Well done. So, brilliant. What do you want to do during your consultation then? What kind of things would we want to do for somebody? chest x-ray and ECG. Yeah, that's an investigation we might do later on, but during the consultation, so you can do an ECG there and then, but firstly you'd want to kind of examine them. So look at their vitals, yeah. Introduce yourself, do an ABCDE consultation, absolutely. Yes, fantastic. Yeah, good. Use a sphygmomanometer. So I can never say that word. So thank you for making me say that. Sphygmomanometer, however you say it, is the manual blood pressure machine. You have to learn how to do it. I have never done it on a ward. I use the machines that do that for us all, luckily. Okay. Okay, so that's what we do during the consultation. Take a history, do an examination, look at their vital signs. And then after, what would we want to do? So somebody already said an ECG and a chest x-ray. Yeah, those things we might want to do. Would we want to take some bloods? Yeah, see how they're doing in their blood work. Those are the kind of the main things. Yeah, we might want to prescribe some medications for them. We might want to arrange some kind of maybe physiotherapy or things like that, refer them on to other colleagues. So yeah, those are all things we might want to do after seeing the patient. So let's look at this person's ABCDE together. So, airway. The patient is just about managing to speak in partial sentences. So their airway is actually okay because they can speak, but it's a little bit worrying because it is in partial sentences. But I'm happy enough to move on to B. What I should have said earlier is, if you find a severe problem at any stage, you stop at that stage and you fix the problem before moving on. So if their oxygen levels are low, you put a mask of air on them, and until their oxygen's fine, you wouldn't kind of make sure to move on, okay? So airway's fine, good. Breathing, so their respiratory rate is high, so they're breathing really fast. Their oxygen levels are low, aren't they? Yeah, and they're on room air, really important. If they were on oxygen and their oxygen, so if they're on an oxygen mask and their oxygen levels were 88 still, I'm even more worried because we're giving this person 100% oxygen and they're still not managing to get any into their body. Okay. You listen with a stethoscope and all you hear is crackles and a wheeze. So to me, crackles indicates kind of some fluid, some fluids going on. It's crackling around in their lungs, and the wheeze is indicating to me that their airways are becoming a little bit narrow, maybe. Yeah, that can be narrowing because they're swelling, or it can be narrowing because of kind of maybe fluid as well. Okay, good. And then we look at circulation. So heart rate is on the higher side. Yeah. Their blood pressure is 130/70. Yes, it's high, but that is nothing in comparison to kind of what you see day in, day out. That's pretty normal, okay, for the average population. Yes, it's high, but it's not like I'm worried. Okay. The top number's high, yeah. The patient looks very clammy. That is worrying. They're unwell, they're sweating, and there is some slight blueness around their lips. And what did I say that indicated if they're quite blue around their lips? Lack of oxygen. Yeah. So anyone know what the medical term is for blue of lips? No. It's called cyanosis, okay? What you'll quickly learn in medicine is that no words can be simple, okay? They all have to have kind of a Greek or Latin word. Luckily for me, I am Greek, so that was actually quite easy, to read some of the medical terms as I went on through medical school. But yeah, cyanosis is the word that we'd use for kind of bluing of things. Disability wise, the patient is alert, so they were on that first stage of that AVPU, so they're fine. The nurses report that their blood sugars have been normal, good. Their pupils are reacting to light normally, fantastic. So we know nothing's going on up here just yet. And then exposure, their temperature is normal, good. So this might not be an infection, yeah, because if somebody had an infection, usually you'd think their temperature would be a little bit high. And they deny any pain, but they feel like they're drowning. Okay. So if we just go back to what we know about the patient, they have heart failure. What is heart failure? Anyone know? If you had to define it. Yeah, the heart's not functioning, the heart is weak. Yeah, the heart stops beating. So if the heart had failed, that'd be, yeah, that'd stop beating. But for now, it's working less well. Yeah, it's not pumping blood enough around the body. Absolutely. Okay. Yeah, the heart is over time due to different illnesses, maybe like high blood pressure over the course of your lifetime, or maybe you had a heart attack that's led to heart failure. Your heart isn't functioning as well. It's becoming weaker, and it's not managing to kind of meet the demands of the body. Okay. So let's look at the heart. Okay. So we've got 4 chambers: atrium, atrium, ventricle, ventricle, right, left, right, left. Into the right side of your heart, you've got your blood coming in from all of your body into the right atrium, your superior vena cava. Okay. And it's all deoxygenated blood. So this blood coming in has no oxygen in it. Okay. So it's bringing all the blood from all around your body to the heart. The next thing we need to do is pick up some oxygen. So what are we going to do? Take it to the lungs through the pulmonary arteries. We're going away from the heart, so it's called the pulmonary artery. Okay. Then we've gone and picked up some oxygen. We're going to come in through the pulmonary vein. Okay, where this is oxygenated blood coming in. It's going to go into the left atrium. It's going to go into the left ventricle, and then it's going to go out through the aorta into the rest of the body, okay, all around the body. So, and kind of give oxygen to all our cells everywhere. Now, the ventricles are what has to pump blood either to the lungs or to the whole body. And can you see that the left ventricle has a thicker muscle? That's because it's pumping it to the whole body. Now, in heart failure, this system of pushing it either to the lungs or to the heart is getting weaker and weaker and weaker. And if you can't push blood, blood tends to pool, doesn't it? It tends to kind of not move easily. It tends to kind of stay. It tends to backlog. And what that can lead to is kind of fluid leaving the blood and entering the structures around. So in the lungs, this person said that they feel like they're drowning. Maybe that's because there's kind of this pooling of fluid in their lungs that's causing them to kind of feel that they're kind of overloaded and they have too much fluid on their lungs and they can't breathe as easily and they can't exchange oxygen because there's lots of fluid around. Okay. Good. So let's move on then. Things we could do to help the patient. As a medical student, there's a few things you can actually do to be helpful. Okay. The first thing we'd do is to sit the patient up. Very simple. Okay. If they're lying down, their breathing's going to be harder than when they're sitting up. So sit the patient up. Okay. And in those moments, patients tend to panic, and I would panic if that's how I felt. And a little bit of reassurance that they're in the right place and we're going to do everything we can to help them can really help calm them down. Okay. And that'll make them feel better inherently. Might want to put them on some oxygen. And actually, that's something we definitely need to do because their oxygen levels were 88. Yeah, so we definitely need to put them on some oxygen. And in hospital, we have different oxygen masks, but the most important one in this scenario is the one that's going to give you lots and lots of 100% oxygen very quickly, okay? And we call those kind of 15 litres of 100% oxygen masks. You just put them on and they give 100%. And in those few moments, whilst kind of doctors are coming in to see the patient, or the doctors are quickly looking through the notes, or they're looking through the medications, you can repeat their observations, because it's important to have back-to-back observations while somebody is really unwell. Okay, so that's something you can do if you were on work experience or as a medical student. Okay, good, fantastic. Now, the junior doctor might have a few more complicated jobs. So we want to look at what this person is doing underneath their skin, and we're going to need to therefore arrange a chest x-ray to look at their lungs. Okay, those lungs might show kind of fluid. Yeah, what we call pulmonary edema. Edema means swelling, pulmonary means lungs, so lung swelling in simple terms. And that's a key sign that somebody's heart failure is getting worse. We also want to do an ECG. So an ECG is an electrocardiogram. These are little stickers that are put across your chest in 12 places, and they're able to pick up the electricity from inside of your heart. And if there's problems with the electricity, we can see that very clearly. Okay. We're going to want to do some blood tests. Okay. And we're going to prescribe them some medications. Most likely here, we're going to prescribe them some medications called diuretics. Now, diuretics are kind of medications that release fluid from the body. Okay, so these medications are going to take the fluid and kind of make you urinate it out. So you get rid of that fluid from your body, excess fluid from your body. Okay, so that's the most likely thing we're going to prescribe to this person. Good. Let's move on then. Does anyone have any questions about that case? Furosemide. Excellent, Delilah. Yeah, that's a diuretic. Very good. Very advanced. Good. Any questions about that case from anyone? So, is that what the junior doctor does, or do we have more roles? Also, do we work as a junior doctor, e.g., if we are doing more training or becoming? So, at different levels of your training, you're going to have different responsibilities. A junior doctor, in the first, 1 or 2 years, your role is to learn as much as possible about different situations. So yes, at first, your tasks are going to be the more tedious tasks, but actually, some of the most important tasks, if we don't have a chest x-ray, if we don't have bloods, how are we going to know what's going wrong with this patient? But you're also going to have opportunities to kind of clerk patients in A&E. What I mean by that is somebody comes to A&E and they're quite unwell, and you will get an opportunity to make your own management plan, absolutely, and treat them. And also in the middle of the night, there's not that many seniors around. You're the one that's looking after patients. You're the one that's prescribing medications and creating plans. So it's not just ordering jobs. It's definitely, looking after patients and managing them and helping them. Okay. And as you move on, you get more and more responsibility. Good. So let's move on to case number 2. Case number 2 is a patient, an 8-year-old female, who is admitted due to a fall and loss of consciousness. I've just finished my geriatric placements on the elderly ward, so this is genuinely what it is every day. On ECG, she was found to have an arrhythmia, so her heart is beating in an unusual way. She had a pacemaker inserted yesterday, which seems to be working properly. So a pacemaker is something that helps the heart beat in a normal way. The nurses have said she has been asymptomatic since, so she's had no symptoms since she had this pacemaker in. And we need to review her before discharge. So this would be a typical patient you would see on a ward round. Okay, so is there any information we would like before going in? What information do we want? The heart rate, her beating pattern, news assessment, yeah. Good. Yeah, we want her notes with us. We want her medications with us. Her latest observations. Yeah. How long ago was the pacemaker paced? Absolutely. What kind of pacemaker? Yeah. Why did she have a pacemaker put in? Yeah. Good. Any recent procedures? Brilliant. Yeah, all those things are vital. Good. What do we want to do during the consultation? We want to take a history. We want to do an ABCDE assessment, don't we? And then after we see the patient, we need to maybe plan their discharge. So thinking about kind of where they're going to go home to, who do they live with? Okay, as you know, a lot of the time, elderly patients and they live alone and they've fallen because they're finding it harder to kind of deal with their everyday tasks. So do we need to involve our occupational health team? Occupational health teams go and look at people's houses. They might install rails for people or kind of stair lifts, or we might need to involve our physiotherapy team to get them kind of up and strong again to be able to walk and do simple tasks. Or we might need to get them some carers to support them. Okay, so those are all the things we might need to do after seeing this lady. So, yeah, so we've asked about symptoms. We've looked at the insertion site of her pacemaker. Okay, we need to make sure that if she's had this surgery to put this pacemaker in, it's not become infected because it's an open wound at the end of the day, isn't it? We need to make sure it's not infected and it's closing properly. Good. So all those things we've mentioned. Now, the junior doctor is going to do, as I said, things that involve other teams, other departments in the hospital. Okay. And the reason we put this case here is to get you thinking about who is around that provides support and helps with different aspects of patients' lives. Okay. So we might send them to a pacing technician. So this is just somebody that specialises in pacemakers and can make sure it's working properly and everything's okay. So that's one member of the multidisciplinary team. As I said before, we might send them to physiotherapists, we might send them to occupational therapists, or we might send them to the discharge team. Yeah, as I said before, the hospital has a discharge team that does all the final things before somebody can go home, make sure everything is in place, they have all the right medications with them that they've been prescribed, so that when they go home, everything's in place, they don't have to worry, okay? And the last thing the junior doctor has to do before the patient goes home is to fill out a discharge summary. So it's a discharge summary is a note, it's a letter that is sent to the GP, okay? And it summarises all the events of what has happened in the hospital, what treatments has the patient had, how have they improved, have we made any changes to their medications, have we increased certain drugs, have we decreased certain drugs, have we stopped them entirely? And also any arrangements that we've made for follow-ups in the future, okay? So maybe we've arranged for them in 3 months' time to go see a cardiologist, so a heart doctor, okay? Or we've arranged for them in 6 months' time to have another scan of their heart to see how their heart's doing. So we need to make sure that all this information is clear so it goes into the patient's records nice and neatly. And if a patient goes to the GP and they're having maybe some heart palpitations, so their heart's, you know, skipping a beat or feeling quite like it's racing, the GP can quickly look at the recent discharge summary and know, oh yeah, this is what they were in hospital for last time. This is what the hospital did. I should continue on with this treatment. Okay. So discharge summaries are really, really important. Okay. So I'm going to do a little bit of a Q&A now. So congratulations. You have now completed your virtual work experience. I hope that was useful. And I'm here to answer any questions now for kind of the next 5 minutes. So let's start then. If you see a patient is not safe to go home, Okay, so somebody's asking if you deem a patient not safe to go home, but like somebody else has said they can go home, then you'd have to intervene. You'd have to make sure that they don't go home and that there's adequate arrangements made so that they are safe when they do go home. Yeah, no. It's like getting the physiotherapy team or the occupational health team. What is the job of the MDT? The multidisciplinary team, they all have lots of jobs. They all have their own jobs. Like the nurses have their own jobs, the doctors have their own jobs, the radiologists have their own jobs. And I think you've got a radiology introduction later on. So radiology being the scans, looking at people's scans and things like that. They all have their own jobs, but they also sit together and work collaboratively to create plans for patients that are holistic. What I mean by holistic is they look at every aspect of somebody's lives. If we are doing further study, how do we work as a junior doctor at the same time? By further study, what do you mean by further study? Is it that you mean you're specializing, or you're doing a PhD at the same time, or you're doing some research? Because if that's what you mean, then you do them at the same time. If you've kind of doing like an academic job, so you can split your work between doing some research and doing some tasks as a junior doctor. Yeah, as well. You're still working as a junior doctor, but you're also doing some research. How long is a shift usually as a junior doctor? So you have day shifts. So those are your normal shifts. They're usually from 8 till 4:30, okay, 5. And then you have your on-call shifts. So on-call shifts are from 8 till 8:30 in the evening. And then obviously if it's a night shift, it's from 8 in the evening until 8:30 in the morning. So 12.5-hour shifts or 8-hour shifts. Do you deal with life and death situations? Yeah, absolutely. You're usually the first person there. Yeah, you're usually the first person somebody sees if they're really unwell. So yeah, you see that every single day. Okay, my roommate is a junior doctor now. She started a few weeks ago. She started her shift at 8 o'clock. At 8:05, she had a crash call. What I mean by that is somebody is really unwell. They might be pronounced dead, and that's when you have to go in and start chest compressions. And she was the first person there to do CPR. So yeah, you have to deal with that every day. Does medicine contain more physiology or anatomy? Both. You can't do one without the other. Is it one doctor per patient or multiple doctors for one patient? It's definitely not one doctor per patient. The NHS doesn't have many doctors as it is. It's definitely one doctor for multiple patients, yeah, or a team of doctors for multiple patients. UCAT questions, other people will answer those for you guys. When do MET calls happen? Is it around the time of ward rounds? I'm not sure what you mean by MET calls. Yes, like if you are training to be, so somebody before said, like if you're training to be a psychiatrist, well, if you're doing a training program to become a psychiatrist, then you're on psychiatry wards. So all your jobs will be psychiatry related, and that's how you're learning the job. So you're still doing the daily jobs of a doctor, but you're learning whilst being on a psychiatric ward. It's put, when performing ward rounds, how often would you perform one in a day, every morning, or whenever it's needed? And do you do it with all patients? Yes, I think we said that at the start. You do all patients. It's usually once per day, but some high intensity units, what I mean by that is where people are really unwell, you might do a ward round multiple times a day. Could I use my weekend job? Oh, I think that's work experience related. Would they give you a case in an interview? No, not they won't give you a medical case necessarily. They wouldn't expect you to have any medical knowledge at all. Certain unis might give you kind of some more scientific based questions. But like we did today, know that you won't be given kind of a case and asked to go through it. But this is more for you guys to gain experience in work experience and what a hospital's like in a virtual way. Good. What have you found most valuable at Manchester University Medical School? Communication skills teaching. Every year, Manchester students are voted some of the best for their communication skills. So that's definitely something I've enjoyed at Manchester. I've heard that night shifts as a junior doctor are quite stressful. What are your experiences of this? They can be quite stressful. And that's because you're some of the most junior doctors in the hospital and you're having to look after a lot of patients. And I think it's stressful at first, but as you get more experience, it becomes easier. Yeah. What do you do if someone is fit to be discharged, but their home environment isn't safe? They stay in hospital, unfortunately. Or they go to like a care home or a nursing home until their home is safe. Yeah. And that's why our occupational therapists are really important members of the team, because they kind of look at people's homes and make sure everything is safe. Okay. Brilliant. So you guys have lots of questions, but I think we're going to move on to the next speaker now. I really hope you've enjoyed it. If you have, my name is Sophia. Kind of please leave me a review afterwards. And I really hope the rest of your day goes well and you learn lots. And yeah, hope to see you all as colleagues in the future. So yeah, bye everyone.
Right, hello. So I'm your next speaker. Can everyone hear me? Hope this is working. Brilliant. Okay, so my name is Mushkan and I'm a second year medic at the University of Cambridge. So I'll be tackling Oxbridge applications and life studying at Cambridge and similarly Oxford. So I've got a little bit of a spiel just to go through and then we can take any questions. Honestly, this is what you want to know about Oxbridge and what it is like studying at Oxbridge. So just drop your questions. I am more than happy to answer them. So I think one of the main things to kind of start off with the Oxbridge application is the changes that are coming into this next application cycle. So I guess for many of you, this your own application cycle. And one of the biggest changes that are happening is the switch from, well, the BMAT exams to, well, whatever's going to be happening. So you may be aware that the Cambridge assessments are now scrapping the BMAT, and therefore that has left BMAT universities to kind of figure out what they want to do with examinations. Now, for Cambridge, they have stated that they're potentially going to be using the UCAT. Oxford haven't made a firm decision yet. So that is something to take into consideration with the application cycle, that these universities are now considering to take on the UCAT, like the rest of the medical schools at in the country. Secondly, I'm sure you might have already heard, is also the whole application cycle and the changes with UCAS. So there's no longer any personal statements or anything like that. Like UCAS is getting a complete redo for the next application cycle. So those are two of the biggest changes that are happening, but the rest of the Oxbridge application cycle has stayed relatively the same as far as I'm aware. So I guess I'm going to talk you through that and kind of answer any of your questions that you've got along the way. So with Oxbridge, it is an early application deadline. So it's usually an application in October. Like the rest of medical schools, Oxbridge have that. And then you are called for interview. And with Oxbridge, the interviews are arguably different to other medical schools in that with other medical schools, you do get the kind of bog standard why medicine and the kind of interpersonal skill questions, whilst with Oxbridge, it's more to do with the science, because that is how the course is more geared towards in Cambridge and Oxford. So for those of you who aren't aware of what the Oxford and Cambridge courses are like, the 6-year course, because unlike most medical schools at Oxbridge, you have to do 6 years. The course is split into 3 years preclinical and then 3 years clinical. So in the first 3 years, you look at a whole range of science kind of topics. You look at anatomy, you look at physiology, you look at biochemistry in like the first years. In the second year, you look at pathology, pharmacology, neurobiology, human repro, and you kind of build that kind of foundation knowledge of the science. Throughout first and second year, you do get a bit more of a kind of clinical aspect with something called PFP, which is preparing for patients. So you do a few hospital visits, a few GP visits, but not as much as you might see in other medical schools. So what makes Cambridge and Oxford is this kind of split from the separation between clinical school and preclinical school. So from 4th year onwards, you go to clinical school and you get much more hospital exposure. You learn about the communication skills that kind of help you become a doctor and like interact better with your patients, and especially taking on more larger scale hospital placements that can go on for a few weeks. So yeah, sorry, I am seeing your questions and I will get to them. Another thing that kind of makes Oxbridge is that your third year is an intercalation year. So you may be aware of what an intercalation is, and I think most medical schools will give you the opportunity to intercalate, whilst Oxbridge kind of almost make you do the intercalation in your third year. For those of you who don't know what an intercalation is, it is a year. I'm pretty sure every university, it is a year that you can either take out when you're doing a different degree, sorry, not a different degree, going to a different medical school, or it is created in the course for Oxbridge as your third year. And you can choose to do that in nearly pretty much anything. This might not be the case for other medical schools, but for Cambridge at least, I can guarantee that you have such a wide range of opportunities and subjects that you can go into for your intercalation. You can stick to the sciences, but if the sciences are something you don't want to do for your third year, you can go into, I don't know, history or management or classics. It is your year to kind of unwind from the stress and the high intensity workload that Cambridge and Oxford medicine do give you in the first and second years, and kind of do something like, okay, I kind of want a bit of a break from medicine, but I want to do something that really does interest me that might be a bit different. So that is currently what I'm in the decision process making of what I want to do for my third year next year. So just to quickly answer about the preclinical clinical, we've had a question about how it's split. So within the 3-year preclinical, your intercalation is your third year. And then at the end of your third year, you can graduate with the rest of your friends and then go on to clinical school. So you gain a degree after your third year at Oxbridge, and then you go on to clinical school, and then you graduate with a degree in medicine and surgery. So that's kind of how it works. You can, at the end of your 3 years, decide, I have done my 3 years at university. I no longer want to go to clinical school, and that's okay. And I think that's the beauty with Oxbridge, that you don't have to be shoehorned into becoming a doctor if that's really not what you want to do. Obviously, for most people, becoming a doctor is why they applied to medical school, and they are so supportive in just pushing you into clinical school. Sorry, not pushing you into clinical school, but like you know, kind of paving out the pathway to go to clinical school and support you through the application to kind of help you, like, support you through clinical school. But if you choose not to go to clinical school, they are also very supportive in finding and helping you find where you want to go post the 3 years. So yeah, those are kind of the general kind of things with Cambridge. I think one more thing is the collegiate system. Again, something you might not be fully aware of what the collegiate system is. So unlike most other universities where you apply to the university, for Oxford and Cambridge, you don't apply to the university per se, you apply to a college at the university. So I kind of think of the collegiate system as kind of mini, I don't know, it's like the house system at school. So they're like little houses dotted around the city. That's kind of how I see the collegiate system. And you apply to one of those colleges. For medicine at Cambridge at least, all colleges apply for the standard, all colleges provide the standard course for medicine, except Hughes Hall. I think 3 colleges provide the graduate course medicine. That's just might be something to bear in mind when you are considering colleges. When you apply, you also don't have to apply to a specific college. You can make an open application, which means that the university will randomly assign you a college and you will go on an interview at that college. So yeah, I think that's also something to consider, because while you will go to lectures with the entire medical cohort from all the different colleges, things like supervisions, which is something I've realized I should probably touch up on, you will do in college. Now, I've mentioned supervisions. This is another thing that is, I think, arguably quite unique to Oxbridge. Other universities and other medical schools do have this kind of similar aspect, but they put it in more like CBL and PBL, whilst Oxbridge do this for their main teaching. So what a supervision is at Cambridge, or a tutorial at Oxford, is it is a small group teaching where it's 1 or 2 kind of medical students or vet students, because we do quite a lot of our first and second years with the vets at Cambridge. And then there's 1 supervisor and you have a supervisor for each module that you take, so each subject that you have in the year. And what they'll do each week, you meet up with this supervisor and you will discuss through the content that has happened in the lectures, in the practicals, and all that jazz. And they will ask you questions. They'll test you on what you know and what you don't know. But it's quite an informal testing. It's not like, oh, you have to know it. They are fully aware that we have other things and other like modules to be doing. So we won't all know exactly what is going on. And everything that we need to know at this moment in time, literally a week after the lectures are done, for that kind of set block of teaching. But they will answer any of our questions. And if there's like a niche thing that we've kind of picked up from the lectures and we want to kind of further pursue that, they will direct us and signpost us to like resources that we can use. So yeah, and at the end of the supervision, they can sometimes set us an essay or set us like MCQ so that we can start getting a bit of exam practice in preparation for the summer exams. So yeah, I think I've kind of outlined in quite a whistle-stop tour of what makes Oxford and Cambridge, and kind of the big differences between them and other universities. I think I'm going to get started on the questions, because we do have a lot of questions that I think I can answer along the way with generally Oxford and Cambridge. So might have now made a mistake that the personal statement might still be here for 2024 entry. I apologize. Slightly still out the loop. But I was under the impression that because of the UCAS reformation, that was coming out, but apparently it's still in. So yeah, knock yourselves out. Make sure that personal statement is as strong as you can make it. How long does the intercalation last? It lasts for a year, 3rd year. What volunteering work is valuable to get into Oxbridge, and any advice on arranging them? Is this something which is favoured in Oxbridge admissions? So volunteering is good across the board for medical school applications. I wouldn't say Oxbridge give it any more weighting than other medical universities do, but they do value that, because it kind of shows that your time management skills, because I think we've got a few questions on workload at Oxbridge. And And just to give you the short answer, it is quite a bit of a workload, and you have to be able to find the right balance between work and play. And for medics and vets, it does get quite hard, but I think if you can find that sort of routine in sixth form, in year 11, with stuff like volunteering, because volunteering is such a huge commitment, I think they definitely see that and be like, okay, yes, they can manage time. That will be transferable to the high workload that is Cambridge and Oxford medicine. How to go about arranging it? Honestly, it's just going to your local charity shop, seeing what other opportunities they have, going to your local I'm trying to think if nursing homes do let, I think nursing homes do let 16 plus in for volunteering opportunities. Honestly, it's just looking at your local area and just seeing what opportunities are there. It is arguably it does get quite hard because you will send email after email after email, or go to shop to shop to shop just to try and get this volunteering experience. But once you get one, they are only looking, they are, if once you've got one, hold on to it and just work through it. If you can get multiple, incredible, but I wouldn't stress yourself out with trying to get multiple. Getting one good one is better than getting multiple and like doing them like half well. So for an intercalation, do you get a master's degree during the year or a PhD? So when you do your intercalation year and when you graduate in third year, you get a bachelor's degree, but that is one bachelor's degree that you get. And then if you decide to pursue that degree further, then you can get a master's, a PhD in it. But then when you graduate again in clinical school, you graduate with another bachelor's degree, that one being in medicine and surgery, whilst the one that you graduate in third year is a bachelor's in arts, in whatever you decided to intercalate in. Yeah, so it's another bachelor's. After an intercalation, what is that additional degree called? So it is a bachelor's degree. It is at Cambridge. I'm not fully sure at Oxford, but it is going to be a Bachelor of Arts. Do you have to write a lot of essays in preclinical years? So Oxford and Cambridge's focus, a lot of its focus is understanding the content. And one way to test the understanding of content is essays. So we do have like supervision essays that we'll write, and we will have one every other week for most modules. So that does culminate into quite a few essays in term. And then in the exams, we do have to write essays as well as having a multiple choice paper and a practical paper for each module. So in each module, we have an essay paper, a multiple choice paper, and a practical paper. So there is quite a large focus on essays at Oxford and Cambridge. So yeah, but I think they're not expecting you to be stellar at writing essays. I can remember some of my first essays in first year, and even arguably some of my first essays in second year, and they were shambolic. But getting the supervisor's feedback to see what you can do to improve those essays, to bump those essays up the grades that you want to get at the end of the year, you do get all the support that you need. And a lot of supervisors are very accommodating. So if you want to send in an extra essay, if you have the time to write an extra essay, if there's a module that either you're really interested in or you're really struggling in to write an essay and you want to get that extra practice, they will support you and they will mark those essays and then give you back feedback. So yeah, can you describe your interview experience for Cambridge? So my interviews were in person. I think they are still in person. They were in person as of this application cycle that has just gone. I'm not fully aware of what they're planning to do next application cycle, probably online, but we'll see. I know some universities are now beginning to do in-person interviews. Oxbridge may take that on. So I had 2 interviews for Cambridge, and each had 2 interviewers in them, and they just asked me a series of science questions, kind of hot topics, but we looked more at the scientific aspects of these hot topics and kind of what I've been doing at A level and further developing them into more university level kind of science. So I think with the Oxbridge interview, they aren't trying to catch you out. They are there to, the people who are interviewing you are there to help you. They are trying. I think arguably what an interview at Oxbridge is like a supervision or a tutorial that you'd get when you are studying here. So it's kind of that experience. So not only does it give you an experience as to whether or not you suit the supervision tutorial kind of atmosphere, but it also kind of gives the interviewers who can potentially be your supervisors in the next years kind of an idea of whether or not you are teachable as a candidate. Are you going to be able to think curiously? If they've stated something in a lecture, will you just take it at surface level, or will you try and push for it? Will you think, okay, well, I've learned about this drug which I know acts on this place, like this, like, I don't know, ribosome, and but it's also acting on a cell wall in a different molecule, in a different microorganism. Why is that the case? It's the level of curiosity that they're looking for. Yes, they want right answers, but as long as you can explain your thought process and why you think your answers are the answers, that's what they're really looking for. They're looking for the curiosity, I think. So yeah, what was the Cambridge interview questions you found the most difficult to answer? Oh, I think there were certain questions which were completely, they were things that I'd never really heard of before. They kind of just showed me an image and I was like, I have no idea what this is. But talking it through with what, like, yes, take a minute just to, like, compose yourself, but don't just sit in silence as you try and think this through. Think it through out loud. So definitely, if you're considering to do an Oxbridge application and aspire to go there, practice talking out loud and like talking through your thought process, because they want to see what you're thinking, because that can get you like, that can let them see what you're thinking, and they can also guide you with your thought process, because they might say, oh, so you've thought about this, have you thought about this potentially? So I think those were some of the hardest questions, just not knowing the image that they've just presented to me, because arguably there were some questions that, the A-level stuff, you can, if you know your A-level content, you're pretty sound for, and obviously they're going to develop that and develop it and push it into more university boundaries, but you can work with them and you can use the knowledge that you have from A-level and transfer it into the kind of scenarios that they give you. But sometimes they can just give you an image and be like, talk about it, and you are a bit stuck, but vocalize what your thoughts. What extracurriculars or programs did you do that you think helped you get in? I think one of the things, so because I was kind of the COVID years, so my GCSEs were affected with COVID, my A-levels were sort of affected with COVID. They didn't have I didn't mean they didn't have the highest expectations of us completing things, but they didn't expect us to have all the experiences that years before us and then arguably years after us had. I think I had a niche interest in war and medicine, which I discussed quite a bit in my personal statement, which I know one of the interviewers who then became my supervisor in first year brought it up and was like, that was something that was really interesting to me, how you had this kind of niche that you were really interested in, and therefore your like EPQ was kind of on it. You've got a career plan towards it. You've thought about, like, you've gone to conferences about it. So it's finding something you're really interested in and then trying to go to talks about it, to try and go to like, if you've got the opportunity to do an EPQ on it, do an EPQ on it, or like any research project on it. So I think that was something that really kind of helped me. I mean, it also made it very easy to talk about in interview if there was something like that. This goes across the board for other medical schools as well. Just having something that I was very passionate about in medicine. I know we don't really like to use the word passionate in medical school interviews, but just having that thing that I was like, yes, I love talking about this. this is what I want to do. I know I've got years to think about it, but I'm starting somewhere with what I want to do. Is it a very high workload? I don't want to sugarcoat it and say it's all sunshine and rainbows, because it isn't. There are tough weeks. There are also calmer weeks. I think that's how you can take a Cambridge term. It is an 8-week term, which means that it is very high intensity, whilst other universities can spread out their term over 12 weeks, 13 weeks. Oxbridge are 8-week terms. So you have to learn arguably the same amount of content that people learn in 12 and 13 weeks in these 8 weeks. So it is high. It's a high workload. I'm not going to lie about it. But there are calmer weeks, and then there are higher intensity weeks. I think one of the biggest things is just prioritizing what you need to get done. What is the important things that need to get done in the week? I know that I'll have conversations with my friends, I'll have conversations with my mom and be like, okay, I've got this and this to do. But I've nowhere where to start. And they're like, okay, why don't you think about what is the important things? Like, what do you need to hand in this week? So your supervisors have essays to mark for you. And I'm like, that's a very good way to think about it. So it's doable. It is doable. There are so many people before me that have done this. There are going to be many people after me that go through the Oxbridge application who succeed at Oxbridge. It's just finding the right balance, because you can do everything that you want. I say you can do everything that you want. You can, if you find the right balance and you are aware that there are places that you're going to have to make sacrifices. Okay, there's a tennis match coming up and you play avid tennis, but you've also got an exam coming up in the next week. You do have to prioritize that exam, but it is Oxbridge, and people are fully aware that the term times and the pressure that can sometimes be associated with Oxbridge does get to us, and there are things that we need to just get done. So everyone is really supportive of that. So yeah, the workload is manageable. What are your A-level grades? So with Oxbridge, you need to get 2 A stars and an A. Most of us get 3 A stars in the end, with another A star and EPQ potentially. So yeah. Do supervisions happen in your college building? Most often, yes, they happen in your college, and lectures are in the different lecture theatres at the different sites. Oh God, there are so many questions. I know lunch is after this, so I can tackle a few of these questions during lunch if you are desperate to hear them. But I think one of the big things is, how do you end up choosing your university, your college, and are the modules the same in every uni? So how do you end up choosing your college? So I go to Trinity Hall, which is one of the smaller colleges at Cambridge. So I visited Cambridge first of all, around the time where things were beginning to open up again. It was 2021. It was a good time. So I visited Cambridge. I visited some of the colleges, but also I just looked at I knew I wanted to go to a tad bit of a smaller college, because I kind of wanted to get to know different people. I didn't want to just be shoehorned into knowing medics, which they're lovely people. I promise you, we're all lovely people. But it's also especially during exam seasons, and just to get away from the medic bubble. I wanted to go to a smaller college so I'd get to know other people from other courses. So I've got friends who do history and history of art and architecture and all these amazing subjects. And it's just a little bit of a break from medicine. But you can consider where accommodation is for these colleges, what funding they provide for their students. All sorts of things come into fact, are they a central college, or are they further out? Are they more over on top of the hill, which is kind of like a 10-minute cycle from central Cambridge? So there are various factors that can go into choosing a college, and I think I chose Trinity Hall because it is a smaller college and it does provide quite a bit of funding for those people who do need it, and especially in IT support. So if things do go wrong with your laptops, your iPads, whatever, Trinity Hall are very on it. They will give you a Chromebook as a backup pretty much the next day. You can apply for this an hour, and then in an hour you'll get someone knocking on your door, or the porter's being like, we have your Chromebook, we can, until you get your laptop fixed, this can be your backup. So it's great. So that's why I kind of chose Trinity Hall, and it's also in the center of Cambridge, so it's quite close to everything. But yeah. I think I'm going to touch upon one question before it is lunch. So if you are not interested in hearing about Oxbridge, feel free to go grab your lunch. I think the next session starts at 12:30. But I'll be here just trying to quickly work through all the Oxbridge questions and kind of clump them all together. So can you have a part-time job alongside the studying? So the answer, the short answer is no. And arguably, with how intense medicine can get, I wouldn't advise a part-time job. Because you also want to have a bit of a social life to be able to do the sports you want to do. Throwing in a part-time job will be stressful. Also, so college says you can have, I think, 4 hours a week, 6 hours a week, potentially. I think it varies from college to college. But arguably that's not enough to, to support yourself. If financial aid is something that is what is driving you to need a job, talk to the college, because the college provides so much funding for people. The funding is there, it just needs to be asked for. If the college don't know you need the money, they are not going to do anything about it. But if they know that you need the money, they are more than willing to support you, and therefore make sure that you can strive in your academics, and also be able to have that sort of work-life balance. How stressful is Oxbridge? Like, do you still have time for personal life and studying and med-related jobs? Yeah. So second year at Cambridge arguably is one of the hardest years in the 6-year course. People will tell you, yeah, if you can get through second year, you can get through the entire medical course at Cambridge. Yeah, I've got friends who are on uni tennis. I'm an army reservist. So we're away weekends. We're doing things during the week, but it's also, we've all found a balance that allows us to balance the things that we want to do and then our academics. And this year, because first year was kind of like our trial period of trying to figure out what works for us and what doesn't work for us. This year we know what works for us, and we are now trying to orientate our lives around both medicine and the things that we want to do. And I think one of the brilliant things is our supervisors are also very understanding. They know that we need to find that balance. Second year is hard for us. So they're like, okay, we can try and organize these supervisions for this times. So yeah, you can do other things outside of medicine. I promise you, it's not all doom and gloom of just sitting in your room and studying, because I think that's a trap that a lot of Oxbridge medics and vets do kind of fall into. I know I'm a culprit of this this time last year. So my first year, Michaelmas and Lent term, arguably was some of the lowest points in my life, because I thought all I had to do was to stay in Cambridge. I had to work every hour God sent. I worked, I ate, and I slept. And that was a very negative kind of way of thinking about it. Whilst this year I was like, okay, no, I'm going to prioritize my academics, but also I realized that to do well at Cambridge and Oxford, you also need to have time to do the things that you enjoy, because it's like, those little nuggets of time where you get to yourself and, you're doing something that isn't medicine or vet medicine. So yeah. How are you able to manage between UCAT and A-levels? So I did my UCAT in the summer and then focused on A-levels. I feel like this might change slightly, given that Oxbridge and other BMAT universities are now considering to put in the BMAT. Oxford, I'm not fully sure of. Cambridge are pretty set on, I think, the UCAT. So that's how I kind of balanced it out. Are Oxbridge medicine degrees worth more than medicine degrees from other universities? At the end of the day, medicine is medicine wherever you do it. It's it's more your preference. So for me, the preclinical, clinical kind of strands work for me. And also, yes, arguably a bit more clinical exposure would be nice, because I've got loads of friends who now who do med at other universities, and you hear all the cool stuff that they're doing. But I think another thing that Cambridge, at least Cambridge I know for sure does, is the vast majority of medical societies that we have that also look at other things. So like Emergency Medicine Society, they've got like a conference coming up at the end of March that I'm going to, which looks at trauma medicine, and gives you kind of more exposure to trauma medicine, which is something I'm potentially wanting to go into. So it's the vast array of societies that are dedicated for medical students to kind of get that exposure that they want before clinical school, which I think is great. So I wouldn't say, I don't want to devalue Oxbridge either. But then again, like I say, medicine is medicine wherever you do it. No one is going to be like, when a patient is needing to be seen by a doctor, they're not like, oh, I need an Oxbridge doctor, I need a so-and-so doctor, I need someone who has studied specifically at UEA. No one is going to be looking for that. They want a doctor who is good at their job. And if the Oxbridge course suits you, and you know that way of teaching is going to help you be the best doctor that you know you can be, then that's the course for you, isn't it? So there's a question about medical focused experience rather than general charity volunteering. So I did general charity volunteering, and that was fine. I've had friends who have gone through the Oxbridge application and they've also done charity volunteering, and that was okay. Even like in the most recent cycles, charity volunteering should not be demeaned, because it is still volunteering at the end of the day. And often these charities are supporting medical causes. So brilliant. So nursing homes do let people aged 16 plus to volunteer. You do have a DBS check. Brilliant. So what did I study at A level? So I did maths, chemistry, and biology at A level. I did history at AS. And I then did an EPQ in second year, in year 13. I dropped history solely because I knew I couldn't manage 4 A levels and an EPQ on top of it. I just knew that I wanted to focus on 3 A levels because that's what my universities were looking at. So yeah. So for the intercalation, no, you don't have to do a personal statement and an application process again. So, well, it also depends on what you want to do. So if you want to do something like classics or management, potentially, but if you're going down the natural sciences route, which is where a lot of medics and vets do go down, you generally just have to apply for this, like, you know, put in your options, and then the university will go from there, because some options are more competitive than others. So I know like pathology, pharmacology, and physiology, development, and neuroscience are quite competitive to get onto. So they might also look at how you did in first and second year to consider. So you can do any course, like law. You can do law at as an intercalation. Law is a bit different though, with an intercalation, because so how the Cambridge kind of degree is split, especially, I'm not fully aware if this is the same at Oxford. So you have part 1 and part 2. Now for medics and vets at Cambridge, year 1 is part 1A, and then year 2 is part 1B, and then year 3 is part 2. But certain courses, like for law, for example, they have part 1, part 2A, and part 2B, I believe, or it might be a 4-year course. Ultimately, if you want to do law, you'd have to do both part 2A and part 2B, because to complete the degree, you need a part 1 and a part 2. So for stuff like law or engineering or music, I think you need a part 2. You need to do the 2 years. So that would make your preclinical years 4 years. But you can do law if that's what you're interested in. No one is going to, well, I'm going to say no one can stop you. The application process might be a bit difficult, but colleges are very supportive of people who want to do this. So the age-old question of luck. with the Oxbridge application. So what did you do on your application to stand out from other applicants, or do you think it's more down to luck? I think ultimately at the end of the day, it's the interview style for Oxbridge that will kind of make you stand out. Because there are so many personal statements, they don't have the highest weighting on personal statements and applications. I think at the end of the day, it's how you do an interview. But the questions you get to interview are random. So there is an element of luck at the end of the day. But I think with Oxbridge, it's the interview which will really make you shine and make you stand out if you can think of interesting ways to kind of tackle these problems. What type of exams do you do? So we have multiple choice papers. So for the core modules, we have multiple choice paper, practical paper, and an essay paper. For anatomy and head and neck anatomy, we also have so the practical paper and the multiple choice paper get put into one paper. So it's like a steeplechase. So you get an image and then questions. And so it's like pro sections and stuff like that. But yeah, there's one module in first year which is looking at like ethics and like law of medicine, which you have to write 2 essays for, but that's in second term and not third term, which is where most of our exams are. Do Oxbridge take into account mental health and offer support? Yes. I'm not going to say some colleges are better than others. I think Trinity Hall have an incredible mental health support facilities. We have wellbeing officers. We have director of studies, which kind of, tackle our university kind of life. And then we also have personal tutors. And I might be biased, my personal tutor is great. I feel like I can talk to her about anything. We have meetings at the start of term and the end of term, and I kind of catch her up on my life and kind of how I've been feeling, how I felt the year has gone, how the term has gone, where there have been ups and downs. I know that I can just email and be like, can we schedule a meeting in? I don't think things are going as well as I want them to. I think there's been a bit of dip in my mental health. I think just things aren't going right. Can we have a chat? And I know that she'll be able to signpost me to, certain things that, like, if it's a workload issue, then she knows that she can signpost me to this. Or if it's just something I just need to talk to someone, she's more than happy to like listen to me. So yeah, the mental health support, yeah, it is there, I promise you. And it, for somewhere like Oxbridge, it should definitely be there. And yeah. Can I bring up the EPQ Duke of Edinburgh in Oxford interviews? By all means, bring up the EPQ Duke of Edinburgh. Especially if the EPQ is relevant to what you're talking about at interview, and the questions that you're bringing up, definitely bring it up. Can struggling with mental health put someone at a disadvantage for an application? Absolutely not. No. I don't think it ever puts anyone at a disadvantage. As long as you can show that you have the passion to study medicine, I don't think it should ever put anyone at a disadvantage for an application. Yeah, you can't like study medicine and then do an integration dentistry. It's not quite how it works. You can't mix dentistry and medicine. Yeah, very long. What was my EPQ subject? So I looked at war and medicine, and how war has influenced the development and use of medicine. So that's the niche that I want to kind of go into eventually in life, hopefully as a doctor in the army potentially. So that was kind of my kind of standout point. That was what I was really interested in. Can I do an EPQ outside of school? I'm not fully aware if you can do an EPQ out of school, because I did mine through school and most people do theirs through school because like the test center per se is school. So I'm not sure. What's your general? I feel like these questions could have been answered ages ago, and I'm sorry I've finally got to these questions. So what's your general schedule like, and how many lectures per day week do you have normally? So this year, well, this term especially, my lectures and practical spread is quite weird because like a lot of my content is in like the first half of the week, and then like Thursday and Friday so chill. So I've actually got like a piece of paper of what I've got to do this week, and this week I had 10 lectures and 6 practicals. However, like 7 of my lectures and like 3 of my practicals were on Monday to Wednesday. Like I had 4 lectures on Monday and a practical as well. Like I was like, oh my God, that's so much content. But then like yesterday and Thursday were like the calmest days on the planet. Like I only had a practical election. It was like solid. I'm out by like 12 o'clock and I can go back home and I can do a bit of chilling. I can have a bit of a nap. I can catch up on a bit of work. So yeah. Do contextual offers exist? I don't think so. I want to say. I know that Oxbridge do have programs for contextual students. As someone who was who came into the contextual bracket, there were schemes that Oxbridge did that I took part in. But giving a contextual offer, I don't think so. Can homeschool students apply? I think as long as you're doing the A levels, I don't see why you can't. Are there scholarships? So when you do get into Oxbridge, various colleges have various funding and applying for scholarships. I know someone who has literally just done an essay and an interview for a scholarship at St. John's for medicine. So the funding is there, scholarships are there. Okay. Okay, what makes you better than other applicants? Have you done anything special? I haven't cured cancer, is what I'd like to say. I haven't managed to do that. I honestly think it's down to the interview and how you interact with your interviewers, yeah, because you're the interviewee. I think it's really down to that and just that interaction and just being able to bounce off conversations and how we think and how we can progress. I think some candidates will freeze and then some candidates will give you the generic answers. And I think it's the unique answers or being able to have the thought process that will get you to the correct answers is what Oxford are looking at. So when applying as a junior doctor, does the university you went to for medical school determine the hospital you go to or alter chances of getting into specific hospitals? Honestly, I can't say because I'm only a second year. I've got 4 more years of medical schooling to before, but as far as I'm aware, we all sit the same exam at the end of 6th year. And with the new change that have come to how we apply to certain certain hospitals, I don't think it matters. Can I type in the exams? At school, so all of our exams were online this year, and I think they're going to be online for the foreseeable future. So typing. And I know in supervisions, our supervision essays are typed because that's how it's going to be in the exams. So what happens if you fail an exam in medical school? It's not the end of the world. Honestly, not the end of the world. I've had friends who failed some exams in first year, and it's not the end of the world. It's just something that happens. You're statistically likely, everyone is likely to, let me phrase this again. Everyone is going to fail an exam at medical school at some point. It's bound to happen at some point. But it's not the end of the world. So with Oxbridge, well, Cambridge, should probably say Cambridge because I definitely know Cambridge. If you fail a paper in a module, you get 1 resit, and then if for whatever reason, so you technically get 2 attempts at this exam. If you fail the second time, then they will look at your circumstances and be like, okay, was there a reason why there was a fail at the second attempt? If there is a fail at the second attempt, then conversations will be had. But colleges are very supportive of making sure you pass a second time round. So yeah, it's not the end of the world. What was how do you handle everything like paying for accommodation, social life, job, uni work, revision? So I work over the summer. I think that's a big thing. I work over the summer, so I get the money over the summer so that I can save to go out and go to university and stuff like that. Paying for accommodation, well, student finances are incredible, and that's what I kind of handle. Revision and social life, that's a big thing about Oxbridge and universities in general. And honestly, it's just timetabling and knowing that some spontaneous things will happen, like a friend's birthday party will come up and they're like, we really want you to be here, or a varsity rugby match will come up, and you want to support your friends. You are aware that things don't always go to plan, but it's okay because we also have long holidays, which arguably is there to help us catch up and revise. So yeah. By not doing an EPQ, would that put me at risk? Okay. By not putting the EPQ, would that put me at risk for not getting an interview at Oxbridge? No, you don't have to do an EPQ. Don't think that you have to. How valuable is an EPQ and what is it graded on? Is that more for Oxbridge or just medical school in general? Because I think someone else can tackle that if it's in general. In general, I know some universities give lower offers if you have an EPQ. I know Leicester does that, because that's what happened for me with my Leicester interview, but yeah. I think it's more what you've done in your research and does it really spark an interest and can you discuss that at an interview? Sorry, most medical street schools usually require no drop to the medicine you need to. No, you don't need to take English or history for A level. I just did it because I was really interested in history, and that's potentially what I'm considering to do for my part two, looking at history and philosophy of science and medicine. So that's why I took history, not because it was a requirement for Cambridge or Oxford. No, that was more an interest. Is it better to go to Oxbridge if you want to travel later on, abroad later on? There are options. I'm not fully aware of what other medical schools do for like electives, but for Oxbridge, Cambridge, I should probably be more specific. Yes, they give you multiple opportunities to go abroad for electives, and some colleges also do research like internships in America. So there are significant opportunities to travel abroad. You have to take chemistry at A level. Is there a lot of chemistry in medicine? In general, I'm not fully sure. At Cambridge, I didn't realize how important chemistry was until I got to second year and there were just these drug names and like different drug processes and drug mechanisms that needed chemistry to fully understand them. I'm like, okay, no, doing A level chemistry was very useful. So it might not feel useful, but you don't actually have to like, it's there to help you understand why the mechanisms are the way that they are, rather than you need to definitely know them. I'm trying to pick out the Oxbridge specific questions, because UCAT prep, I'm pretty sure that you'll have a session on UCAT prep, and if you've not already had one, for that. Yeah, so you'll be starting UCAT prep in about 5 minutes. But yeah, I don't know if okay, there's one about further maths and Cambridge. No, because Cambridge only look at 3 A levels. If you do further maths, fair enough. I've had friends who did further maths. I had friends who did physics, as well as the 3 A levels that they did. It doesn't really age you per se. If it's what interests you, knock yourself out, do it. I had friends who loved further maths and therefore continued it. But yeah, if you don't really like chemistry, would you have hated second year of Cambridge? No, I don't think I'd have hated it. There are low points I've had, but I've never at any point hated my degree at any point at Cambridge. There have been low points and there have been points where I've been like, but not the content is interesting. It is very interesting, especially second year. Second year has been really interesting for me. So yeah, I'm gonna try and get these questions done 4 minutes. 4 minutes before your next session starts, and trying to specifically try and get is 6 years for medicine worth it, or do you think 5 years are fine? I think what with Oxbridge, it's the intercalation, and I knew I wanted to do an intercalation regardless of where I went to at university. So for me, 6 years was always going to be it. But I know people who've done incredibly well as doctors doing 5 years. So I think it's down to what you want to do for the course. Does Oxbridge only look at core subjects for GCSEs? As they look at, they make sure that you've attained well at GCSEs, but if you're like, I know people who have got a 6 in French and have still applied to do Oxbridge Med and have been successful. What would you say is the best thing about studying medicine at Cambridge? That you are being lectured and supervised by some incredible people who are doing some incredible research, and some people are like the pioneers of, that research in that kind of area, and you are being lectured by them and you're being taught by them, and it's just phenomenal that is the case, and I'm privileged that I get to have that kind of experience. Also, I think people say that the Cambridge bubble is not negative per se, but it can be quite stifling. But I think being in the Cambridge bubble and then going home and then coming back to the Cambridge bubble, it's a beautiful thing. I don't think you ever get quite an experience like Cambridge and Oxford. It's very unique. I don't know if that's all the Oxbridge questions, and I think that might be all the Oxbridge questions. So yeah, I'll give you just 2 minutes before your next session, but thank you very much for listening to me yap on for the last hour. It's been great answering your questions. But yeah, I hope your application processes go really well, and I hope to see some of you at Cambridge soon, because I'm sure I'll still be rattling on here at clinical school by the time some of you get here. So yeah, enjoy the rest of the conference.
Hello, everyone. I am aware that you didn't get to have lunch. So I'm going to give you what I can. I'm going to give you 5 minutes to get some tea, get some water, whatever you want. I'm also going to put up a quick slide, if I can figure out where that's gone. Just so we can do this as quickly as possible. No, that didn't work. Okay, so let's have a very quick look at this. I had a message in the chat. Yes, I am aware some of you went for lunch, but I'm also very aware some of you didn't. So that's why you've got 5 minutes. This is a very quick slide just to let you know that there is a giveaway. We are giving away some of the UCAT books from Medicat. They are very, very good. And I would recommend that you've got nothing to lose. You can participate by sharing something from the conference today on Instagram or on TikTok. You can also share or like any of the posts or comment on any of the posts on our Instagram. So yeah, if you want to do that and you want to participate, then good luck to you. There's also a link to leave feedback for today, but we'll come back to that later and tomorrow as well. The other thing is that if you do want more support and you are thinking of going for any of the packages that Medicat offer in terms of support, so that's your UCAT support, your support for interviews, personal statement, everything like that, we do have a discount code you can use. So your discount code is right here on the top. It's 20 off, and you can use it until the 1st of March if you want. It's a good thing to save just in case you want it. But yeah, I'm going to give you a few more minutes, grab some tea, grab some water if you want, and then we'll come back and we'll do UCAT in about 2-3 minutes, okay? And then we'll go into the general Q&A at the end. Okay, everyone. We're going to go into UCAT prep now. Especially for those of you who are just listening to the Oxbridge talk, this is quite important. This is the part where we talk about how to get the score that gets you in. So since universities like Cambridge are now using the UCAT, this is something that's quite important for everybody who's applying, not just kind of those of you who are going for like traditional UCAT universities or UCAT universities as they used to be. I am happy to take questions about what we're covering, but if they're more general questions, you can still put them in the chat, but I will cover them at the Q&A at the end. The UCAT is the kind of test where I think people often tell you that you can't really prepare for it, or it's difficult to study for, or it's just based, it's like an IQ test, right? It's based on natural talent, like you can't study for it. And I can honestly tell you that that's very much not true. I was the kind of person where I went to the UCAT and I thought, this is a very difficult exam. I don't like this. I don't want to do this. I'm going to fail. And I prepared for it for 6-7 weeks. And my score went from kind of like the kind of halfway, like, you know, like the very average kind of score to a score in the top 1%. So it is a score that got me into any UCAT uni, essentially. I could apply wherever I wanted for the UCAT unis. And that's a really big privilege to have. That is your goal, right? Because the UCAT doesn't close all doors for you. You can still be a doctor if you don't score super well in your UCAT. That's fine. But it does make your life so much easier, like incredibly easier. So I would highly recommend that if you are going to put 100% effort into anything this summer, let it be the UCAT. Is Oxford using the UCAT? They have not confirmed, but there aren't that many alternatives, right? So there isn't really another admissions test they can use unless they make their own, and that might happen. But it is unlikely for this year because it's a lot of effort to create an admissions test. So we don't know. I would say probably, but we have nothing confirmed. So keep an eye on their website. They said they would announce it soon. Cambridge has said that they will be using the UCAT, so it's expected Oxford will follow, but we don't know yet. Is kind of the answer, unfortunately. Okay. UCAT strategies. The first thing is performance. How do people generally speaking do? Because I'm aware that you guys probably don't know very much about the UCAT, right? Like, if you know that it's an admissions test for medicine, I'm already impressed because at your stage in kind of like February of year 12, I didn't know very much. So generally speaking, looking at this, people do fairly all right? So the UCAT is scored from kind of 1,200 to 3,600. And anything above 3,000 generally is in the top 1% or the top 2%, depending on the year. But people do different in different sections. So you have 4 sections that are scored numerically in the UCAT, and then you have your ethical reasoning, and that's scored differently, and we'll cover that at the end. But your 4 numerical sections are verbal reasoning, decision-making, quantitative reasoning, and abstract reasoning. Now, verbal reasoning is your reading section. That's about reading comprehension. It's, can you read a text? Can you understand the text? Can you tell me the answer to these questions I've asked you about the text? That's what it does. Decision-making is about reasoning in terms of logic. It's a bit like an IQ test. It has all these weird questions like, which one is the best argument for this point? Or if I tell you these weird sentences that don't make sense, can you give me an answer to what they might mean? Or what conclusions you can draw from them? It's very much a quite abstract section, but it is very useful. It's a good one to prepare for. Quantitative reasoning is an easy one to improve. If you want to get your score up quickly, quantitative reasoning, it's your math section. If you can do GCSE math well, you can probably do quantitative reasoning. But quantitative reasoning is not difficult because of the questions they're asking you. They're asking you to do percentages. Hopefully, all of you can do percentages. But they're asking you this in a weird way. They're asking you this with a table, with a graph, in a question that you don't quite understand. So that's the trick there. And then you've got abstract reasoning, and that's the one with the weird shapes. That's very different. Some people love it, some people hate it. But it's generally speaking, so quantitative reasoning here and abstract reasoning are the sections where people do best, because they're sections that you can improve on quickly and well. The sections that are more tricky to improve is verbal reasoning, because apparently no one really likes the reading comprehension section, and your decision making. Now, for me, verbal reasoning was by far my best section, because I love reading. I used to read 1 to 2 books a day. Verbal reasoning is easy if you do that. If you're not that kind of person, and I'm expecting that most of you are not, I'm not expecting you to read 2 books a day, then that's fine. But you can improve on this, and I'll give you some tips of what you can do right now, because you are so early on in this process, and you're doing really well for being here, that you can still improve so much so easily. And that's really, really helpful. It's a lot harder if you start in June. So much harder. So do yourself a favor, do the easy stuff now, essentially. But that's just to show you. So your average score for the UCAT is around 2,500. And generally speaking, people do best in the quantitative reasoning, the abstract reasoning, and they do worst in verbal reasoning. And that's just how it is. Let's start on verbal reasoning. Like I said, it's the reading section. Now, verbal reasoning is difficult, not because you have to read and understand things. It's difficult because you have to read and understand things in 30 seconds. It is not a section where you have the luxury of time. So your strategy for approaching every single question is really important. I cannot overstate this. It's so important that you do this properly, because if you have a strategy and you give up halfway through, you've lost essentially. So stick with your strategy, practice, practice, practice. You've got 21 minutes in this section. It's your first section when you start the UCAT, and you've got 44 questions to answer in 21 minutes. They've all got text. So you've got 4 questions per piece of text, and you have your text on one side, and then you have your question on the other side, and it just changes the question. The text stays the same for 4 questions. Your text depends on the question. Sometimes you get text that's quite long. That tends to be slightly easier text, or shorter, which tends to be more complicated text, although it depends on the year. You don't need to study anything. There is no requirement for you to know history, science, maths, whatever. But there is a requirement for you to be able to read really fast and understand and retain really, really well. It is the section where people do the worst. So it is a section that's difficult to improve in, but not impossible. And if you're thinking of applying to universities like Nottingham, Nottingham doubles your UCAT score for verbal reasoning. So they look at your score for the whole UCAT, and then they double the verbal reasoning one because they think it's so important. There are studies to prove that people who do really well in verbal reasoning do better in medical school. I can't personally speak that. I've not seen that in practice, but there's a study that shows that. I will answer all the questions about this. I'm going to answer one of them right now. So how are the texts complicated if new knowledge is required? Is it the grammar? No, the text, you don't have to study anything for this, but the text is, for example, a science-based text. They're not requiring you to know the science. They're giving you a text, for example, about anatomy of a platypus. You're not required to know the anatomy of a platypus, but they will look at you will look at the text, and you will answer a question based on the text. All of this is multiple choice, yes. I'm going to cover the Nottingham question later. let's look at what we do to improve our score in verbal reasoning. There's 3 things, and there's an extra piece of advice I'm going to give you at the end. Now, speed and understanding, that's your kind of general advice for verbal reasoning, right? That's what everybody will tell you. Improve your reading speed, improve your understanding. That doesn't help you. Now, what you can do to actually do this is 3 main things. Subvocalization. Anybody, put it in the chat if you know. Anybody know what subvocalization is? Because there's 150 of you, and so someone will know. Good. Yes. Reading in your head. It's when you read, but it's like you're hearing the words in your head. Some people do this. Some people look at text and they like read it out loud in their brain, and that's normal because that's how you learn to read, right? That's how we've all learned to read. But that's not good for verbal reasoning because it limits how fast you read, because you can only read as fast as you can speak. So that's not good. You can get rid of that. It's tricky, but you can. You can do things like chewing gum while reading. You can do things like putting something on your lips, because some people like form the words with their lips. So if you do that, for example, then you can put a finger on your lips, or like I had a student who put a sticky note there, whatever you want. And that helps. But things like chewing gum help because your brain is focused on chewing the gum and not so much on saying the words. Figure out what works for you, but that's one that's really good and fairly easy to do. Not reading every word. Again, that takes practice. There is nothing super easy that you can do that really helps with that. One thing you can do is, for example, just look at certain words in a sentence. So that's your nouns and verbs. That's essentially what makes your sentence have meaning. We don't care so much about adjectives. We don't care how things are. We care what happens, who does it happen to, when does it happen, things like that. So only focusing on those words, that takes practice. That takes a lot of practice. So much more difficult to improve, very much worth trying. The last one is backtracking. And that's when you've read something and then you go back to it. Again, tricky to improve, really good thing to practice with someone else, or to practice by reading kind of long texts. So for example, if you're reading a sentence and then you're going back to the bit in the sentence. So for example, your sentence is about the anatomy of a platypus, right? And you go back to the fact that the platypus has a poisonous spike, but you didn't quite understand that part. So you go back to it and you reread it. Don't do that, essentially, because it wastes your time. And probably that piece of information wasn't important enough for you to waste time on it. Most of verbal reasoning is about knowing where things are and the general idea of it. Not so much what is the specific, because you can go back to the text and just scan it again if you do need it, but you probably won't, okay? Now, sometimes you don't even need to read the text, and that's the really good news. For all of you who don't like reading, that's the really good news. Sometimes you don't need to read the text. I had a question. What should you do if you have to keep reading the same sentence over and over because it won't go in your head? Skip the sentence. It's probably not that important. Just skip it. Worst case, you come back to it, but it's not worth wasting that much time on one sentence in verbal reasoning. It's about priorities, essentially. Focus on the rest of it. It doesn't matter. So back to read or not to read. You have true, false, can't tell questions. And those are your questions where, I'll show you in a second. Oops. It says things like, the mountain erupted in 1816, right? That's a true, false, can't tell question. They give you options of true, false, and can't tell. Now, those questions we don't actually read because, well, we read the question, but we don't read the text. We look at the question and we pick a keyword. Now, a keyword, for example, is usually something that holds a lot of meaning in a text. That might be a date. Those are easy to find. Or a proper noun. So anything that's capitalized is a noun. And you can go back to the text and just look for where that word is mentioned. And you just read that part. And often it gives you the answer. And it saves you having to read the whole text. Does that make sense to people? Because that's a really important part. That's what's going to get you lots of marks in verbal reasoning. So do we understand what we mean by not reading the text? Okay, cool. Statement-based questions are, oh yeah. So somebody asked me to explain again. So what you do is, I'll show you with the example. We'll still do the question, but I'll show you with the example. So for example, the Mount Tambora eruption occurred in the year 1816, right? you would not look at the text first. You would look at the question first, and you would pick a word in here, for example, Mount Tambora or 1816, and you would look for where it was mentioned in the text. And that's what you use. You just look where it was in the text, and you read that bit and see if it gives you the answer, because very often that's what it does. So that's your scan and search technique, as it's often called. Really useful. I'll go back to everything else if you want at the end as well. Statement-based questions are different. So again, we'll do the question in a second, so please don't put answers in the chat. But yeah, we'll do the question in a second. Statement-based questions are different. They are your questions where you get 4 answer options, and I'll show you one later. And there you have to read the text, because often they require you to have a bit more of an in-depth understanding. It's not so much a surface level. It's more about, can you draw conclusions from it? Can you really understand what this means? Can you understand people's opinions? And you have to read the text. There's not really a way around this. I scored very high in verbal reasoning, and I've tried every possible technique. And I can honestly say, even as somebody who reads very fast, you have to read it. There isn't a way around it. There's lots of suggestions, and if you find something that works for you that isn't reading the text, amazing. But I've taught hundreds of students, and for 95%, you just have to read it, because scan and search is very, very time consuming in statement-based questions, unfortunately. But yeah, you have to read the question. Well, you have to read the text, and then you have to read the question and just answer it, unfortunately. But we'll do an example in a second. Again, like I said, I'm going to show you a statement-based question in a second. Do you not get both true and false questions and statement-based questions for the same passage? You do not, no. You get either true, false, can't tell questions for a text or statement-based ones. Usually out of the 11 passages you get 2 true, false, can't tell passages, and then you get 9 statement-based ones. So it's mainly statement-based. But the true, false, can't tell ones are great because you can save time by not actually reading them. Okay, I'm going to give you this question. I'm going to give you a poll, and I'm going to give you a minute and a bit to answer the question. And we will see how you guys do. Please put it in the poll, not in the chat. There is a poll for a reason. The poll will come up on your screen, or sometimes it's at the bottom when there is a bit for polls. If you click on it, then it comes up. It might have opened in it opens in a separate tab, so it might be behind another window. 10 more seconds to put your answer in the poll, and then I'm going to finish the poll and we're going to look at the answer together. Okay, I'm going to end the poll here. So one person's got their hand raised. Yes, do you have a question or do you have a comment? Or neither of those? Okay. That's fine, don't worry. I had another question in the chat as well, but I'll answer that later. So most of you are right. Most of you said that this was false, and you are indeed right. It's mentioned in 2 separate places. In this case, if you scan for the word 1916 or number 1916, you won't really find this. Often when it's false, you won't find things through the first keyword you pick. You might have to pick a different one. So in this case, if you look for Mount Tambora, then you will find the answer, and you will find it actually happened in 1915. So the answer is false because it's not true, essentially. Fairly straightforward question. These questions are great. You can save time on them. You have 30 seconds per question, theoretically, but these ones, if you can do them in 15, 20 seconds, great, that's your goal. That takes practice, that takes time. No one's expecting that right now, but that's your goal, okay? Now, moving on. This is a statement-based question. So statement-based questions, you have a text, you read the text, you answer the question. I'm going to give you a poll, and then we're going to put the answer in the poll again. Okay, I'll give you 10 more seconds to put your answer in the poll. About half of you have answered so far, so I'll give you another few seconds, but try and answer if you can. Even if you're not sure, no one can see what you answered, so worth a try at the very least. Okay, I'm going to end the poll here. So this one is a tricky one. Somebody had a question about reading the question first or the answers first. That's a really, really good question. I should have mentioned that. So you read your text first. Don't read the question first because you've got 4 questions. And if you read the question first, usually you're looking for the answer to your question, but you've still got like 3 more questions to go. So it's not really helpful to only look for the answer for that question. So read the text first, then read the question, because otherwise you are at an advantage for that question, but you are at a huge disadvantage for the next 3 questions, and that just doesn't save you any time. Again, the general questions I will answer later, because if they're not related to the question right now, then we'll do them in the Q&A. So I had another question of, can there be more than one correct answer? These are single best answer questions. And what that means is that they're much like medical school exams. There can be more than one answer that's kind of right, but it's always only one that is right. So single best answer means that there is a best answer, an answer that is most correct. And the other ones might be slightly right. There might be parts of them that are correct, but they're never fully correct. So yes and no, essentially. A question for extra time I'm going to answer later. How long should we spend on this type of question? You have 30 seconds, essentially. But you will take longer because the first time you do these questions, you will read the text, and then the following questions will be about the same text. So the first one will take you like a minute and a bit, and then the next one will take you like 15 seconds. Will the question answers be in order for each test, or will they be randomly in the passage? Very good question. They're randomly assigned, like it's a random order. You can't rely on your own knowledge, no. So if you know the answer, but it's not in the text, then it's still can't tell, for example, or it wouldn't be a correct answer because it's not in the text. Very good questions. So going on to the answer, your answer here is D. D is mentioned in your 3rd paragraph, and it says, on their way to the International Space Station, our national lab orbiting Earth. Some of the other ones have some evidence, but they're never fully correct. So for example, C, in the first bit here, let's see if I can highlight. So NASA astronauts have launched from American soil in a commercially built and operated American crew spacecraft. So it's kind of right, because it says the launch of the Crew Dragon spacecraft on Saturday was the first test, or no, this is the first time the NASA astronauts launched from American soil. Kind of, but it was the first time they launched from American soil in a commercially built and operated American crew spacecraft. So there's like extra conditions there. So it's not fully correct because they could have launched from American soil before, just not in that kind of spacecraft. So some evidence, but not the right answer, if that makes sense. And that's how UCAT questions work. They can be kind of right, which is, you know, a huge hassle and annoying, but unfortunately that's how they work and that's how they get you. So it's important to have a good understanding of texts when you see them. So that's what verbal reasoning questions look like. That's your whistle-stop very fast tour of verbal reasoning, essentially, and how that works. Let's move on. Decision-making. Again, I'm going to answer general questions and like catch-up questions at the end as well. Decision-making is your next section. So you start with verbal reasoning. Once that's done, it times out, you go on to verbal reasoning. In verbal reasoning, you have 29 questions and you have 31 minutes. So you have about a minute per question. It's a bit less time pressured, still quite time pressured. Your job is to deduce information. And you get, in the UCAT, you get a whiteboard to use. And that is really useful in decision making. It's not really any use in verbal reasoning, but it's really good for kind of logic puzzle type questions, anything like that. And that's when it's so, so good to use your whiteboard. Now, this is useful because as a doctor, like we've seen the virtual ward round, for example, you always have to draw conclusions from what you're given. You have to reason, and verbal reasoning kind of tests the reading aspect of that, whereas decision-making tests the decision-making aspect of that. Now, again, we're going to look at some things you can do to make your score a bit better. Decision-making is a difficult section to improve in, but it's very heavily based on strategy. So if you know how to approach the questions, your score goes up a lot very quickly. And then it's just practice, essentially. So the first thing we're looking at is probability. Hopefully, all of you remember some probability from your GCSE days. I know I hated probability, but probabilities are really easy marks in the UCAT. So, for example, if I'm flipping a coin, I've not got a coin, but if I was hypothetically flipping a coin, I could get heads or tails. And if it's an unbiased coin, if it's a normal coin, I've got a 50-50 chance every single time. So the chance of it landing on heads is half. Now, what's my probability of getting the same side twice? So getting heads twice or getting tails twice. Someone in the chat tell me, what's my probability of getting the same one twice? Okay, so what's my probability of getting heads twice? But if I'm looking for a probability of getting the same side twice, not necessarily heads twice or tails twice, just either of them, good. One person got it. Yes. Because I'm looking for the probability that I get the same side twice. I don't care if I get heads twice or tails twice. I'm just getting the same one twice. So this is what that looks like. I'm trying to get heads twice. So I've got half chance of getting heads and then half chance of getting heads again. And if you remember your probability trees, and this is probably horrible flashbacks to GCSE for some of you, you have half and you have half, and you multiply them if you go along, right? I've still got the highlighter on. You multiply them if you go along the probability tree. So to work this out, you multiply half by half and you get a quarter. And that's your probability of getting heads twice. But then if you want the probability of either of those happening, you have to add them together. And that's when you get a quarter plus a quarter gives you a half. So your probability of getting the same one twice is a half. That's your probabilities. That if you understand this, that's super easy marks that you can get that will save you so much in decision making. That's like 3 or 4 questions right there if you can do this, if you can do it quickly, and especially if you can do it in your head. Okay, so this super important, super easy to learn, and easy marks. That's the first part. So that's your probability. Now, this, very different, is your shape equations. And shape equations are the bane of many, many people's existence. I love them. Some people absolutely hate them. But they are about working out. Again, I'm going to give you a poll for this, so don't put an answer in the chat, please. But they are about working out things in a very weird and warped version of algebra, essentially. So I'm going to give you a poll. What we're trying to work out here is we've got some equations like a square plus a square equals a triangle. And then we're trying to work out how many squares a circle is equal to. I'm going to give you a minute to work this out. And then we're going to go through how we would do this. Because there's easier ways and there's more difficult ways for all of these. Good. 10 more seconds to put an answer in the poll. You guys are doing well on this question. Okay, I'm going to end the poll now. Good. Over 100 of you answered the question. That's really, really good. and most of you got it right. Just about 60% of you got it right. So that's really good for the stage that you're at. Now, what we do for questions like this is we look at trying to write this out in a way that makes sense to us, and then just treating it like normal algebra. Because this is really tricky if you are trying to do it with shapes, because you're drawing out all the shapes and it's a huge hassle. We don't do that. So what I do first, because I like things organized, which good quality in medicine, just to point that out, is I write it out. So 2s, 2 squares equals t. You can name them a and b and c. I do not recommend that. It gets very confusing very fast. C minus t, so circle minus triangle, equals 3 triangles. And my circle equals question mark or x squares. Now, that's what I start with. Makes my life easy. Then I'm trying to figure out how many squares I need for my circle. The easiest way to do that is to look at my other equations. So, for example, my second equation here is c minus t equals 3t. So what I can do is I can rearrange that, and I can put the t on the other side. So instead of having c minus t, I do plus t for both sides, and I end up with c equals 4t. Now, that doesn't tell me anything about squares. But you know what does tell me about squares is equation 1. So now I know that I have 4t from equation 2. And I can use equation 1 to say that instead of c equals question mark s, I'm going to copy this down here. So I'm sorry, my handwriting has slowly morphed into doctor handwriting over the years, but I hope you can all read this. So c equals question mark s. I'm going to try very hard to make this readable. And 3t equals, no, it doesn't. C equals 4t. And now I've got equation 1. And equation 1 tells me that 2s equals t. So if 4s equals t, no, if 2s equals t, then in order to get c, or to get my s here, what I need to do is plug my equation into that. So I get s is 8s equals c. So those of you who put 8 are absolutely right. So about 60% of you got this one fairly quickly as well. So these questions, easy if you understand them, tricky if you don't. They come up every single year. They are very easy questions to get right if you know how to do them. They're very easy questions to practice as well, because if you do 15 of those, you've usually got them down. So really, really important. Yes, this is part of decision making. It's a very classic decision-making question. There's many different ones. There's probability, there's this, there's lots of other ones. Decision-making is very there's many, many parts to it. So that's your shape equation. We'll talk about calculators in a minute. Another part of decision-making is good arguments. Now, this one is very different to what you do in the rest of decision-making. This is about what is a good argument to make for a point. So, generally speaking, to make a good argument, you need premises and conclusions. Anybody know what a premise and a conclusion is? Good, so conclusion, yeah. The conclusion is a final statement, yeah. Yes, good. So one of you got it very, very right. A premise is a fact that backs up a conclusion. A premise is a statement that leads you or backs up your conclusion. So yes, lots of you got this. Very good. So premises are the ideas, they're your evidence, they're your facts, and they support your conclusion with just a final statement you arrive at. And to make a good argument, you need both of those. Now, lots of arguments that you will see wherever you go, in the media, in elections. I think Scotland's having an election right now, so I know, got lots of election mail. They don't have that. They just have a conclusion, for example. They just say, oh, this. But that's not an argument. It's just a statement. So to have a good argument, you want premises and you want conclusions. That's what makes a good argument. And in order to arrive at a good conclusion, your premises have to support the conclusion. That sounds obvious, but it's not always obvious. You sometimes have premises that are unrelated to your conclusion. You sometimes have premises that are not very sound or they contradict each other. And that's a big no. So a good argument is made up of premises that are supportive of the conclusion you are giving. I've not got an example for this because we've got very little time to finish up today. But if any of you are very curious about this, I can show you a question later on if you want to stick around in the Q&A. But for now, that's your whistle-stop tour of decision-making. There's other parts of decision-making as well that we don't have time to look at, but these are kind of 3 main parts of it. There's about 6 question types in decision-making. We've covered about half of them. Quantitative reasoning. Very different section. So I'm just going to have a sip of tea because my throat is absolutely parched. In decision-making, you have some maths, like a bit of, you usually really just your probabilities. Quantitative reasoning has all the maths. Lots of speed equals distance over time, lots of easy percentage calculations, essentially. Really, really good to do in a short amount of time, but really important that you have a good grasp of what all of these things mean, because quantitative reasoning really rests on having confusing wordings for things, if that makes sense, or asking you things in a very strange way. Give me 1 second to have some tea. Okay. In quantitative reasoning, much like in verbal reasoning, you get given a scenario. So you have like a stem of a question, which is, for example, a text in a table or a graph. And then you have 4 questions based on that. You have 36 questions, you have 25 minutes, so about 40 seconds per question. And for every single one of these sections, you get a minute of reading time. And that's the time in between the sections. So when you start the exam, a screen comes up that tells you, this is verbal reasoning. In verbal reasoning, you will be asked questions about texts that are presented to you. You should not be using your own knowledge. Please answer all the questions. And that's kind of what it says. You have a minute to read that before the section starts. That's the only break you get because you cannot pause the exam. No one can. Not your examiner, not you, no one. So that 1 minute is the only time you have to breathe, to forget everything you did in the previous section, and to focus on what you're doing right now. So use that as my big piece of advice, because it helps. The deep breath really helps. So what do we do for quantitative reasoning? First of all, know how to use the calculator. Your calculators are on your screen. You do not get a physical calculator. You can try this if you are on a laptop right now. You can go on the UCAT website. Let me see if I can find this. Yeah. So I'm going to send a link in the chat and you can have a quick look if you want. Everyone. If you click on this, it takes you to the official UCAT website. And you can, this is the practice test section, and you can go on quantitative reasoning. And it takes a moment to load and everything. But if you start on that section, then on the top of your screen, well, after you click through all the other stuff, there's a bit that says calculator. And then the calculator, as it would appear in the exam, will show up. This calculator, useful, but weird to use. So very, very important that you use it during your practice, because if you use a real calculator, physical calculator during your practice, you get used to that and you can't then start using this during the exam because it takes much longer. So please practice the way that the exam is actually structured. You're not doing yourself any favor by taking shortcuts. So that's your calculator. It has a few functions that are quite good. It has a few functions that are a bit useless. The one that is important is your memory functions. Some people really like these. I don't think that they are very good if you get easily confused. However, if you are the person that loves using them, they are very helpful. Practice with them, see if you like them. If you don't like them, leave them. What they do is they add your number to the memory, and then you can recall it by pressing the same button, and then you can use it in calculations. That's helpful if you have long calculations or if you're doing things like interest, but not so useful when you're doing everything else. Essentially, use with caution, okay? So memory plus, which is your button right here, I'm going to zoom in on this because I don't think you can actually see otherwise. Memory plus is the button that you use to add the number to the memory. Memory recall, this button here, is the button that you use to put it back on your screen. It's very simple, but it is also not all that simple when you use it in practice, when you're stressed. So practice with it. Memory minus removes the number from memory. Yes, like I said before, you get a whiteboard for all of the UCAT. Now, compound interest questions are questions where the memory function is useful. If you've got the UCAT website open, you can try doing this calculation on the UCAT website in the calculator. You can try doing this. You can use the keyboard to operate the calculator, but not all of the functions. Like memory plus, for example, there's no keyboard shortcut for that. You can try doing this in the calculator, or you can try doing this on your phone calculator or whatever you want. And then you can put the answer in the chat if you want. And then I'll show you how I would do it in a UCAT calculator, because that's a bit different. Very good. Lots of you got this one. Very, very good. So, like we talked about with the memory functions, what you do in the UCAT calculator is you take the number, that's your interest, right? So you're trying to work out the interest. In this case, the interest is 8%. So we know because it's an increase, we use 1.08 because increase of your 100%. So you have 108%. You add that to your memory. And then what you do is you type in the number you started with, which is your 90,000-ish pounds, 93,450 pounds, and you multiply it by the memory recall. That usually works quite well. You might find that the function doesn't always work, so I would use it with caution. I would use it very consistently if you want to use it in the exam. But this is what my suggestion would be for how you use the memory recall function if you do use it, okay? So that's how it works. Not super complicated, but it gets a bit more tricky when you're doing it in a really hectic environment. All of the questions are multiple choice, yes. You do not get rough paper, you get a whiteboard. Now, percentages are one of the most common questions you will get in your exam. That means finding a percentage of, no, it's not an online whiteboard, it's a whiteboard. You get a physical whiteboard. You have to find the percentage of things. You have to calculate percentage increases or decreases, reversing them. You have to, anything in percentages essentially is pretty much fair game for the UCAT. Lots of other questions as well, but a lot of them are percentage questions, to be honest. Now, trying a different question that's slightly similar. So I'm going to give you a poll again and we're gonna work out if you know how to do this question. And we will see how you do. Again, you can use your calculator if you've got it open. Can I ask, to make it fair for everyone, to please not put answers in the chat or put numbers in the chat, because everybody should have the chance to attempt the question. Okay, it's been 1.5 minutes. I'm going to give you 10 more seconds to put an answer in. Only 30% of you have answered this one. Hopefully most of you know how to do this, but I'll go over how if you don't know it in a second. Okay, I'm going to end the poll here. Some of you got this right, not that many of you, and most of you didn't answer. So I'm guessing that this question is more complicated than I anticipated. So let's try this. First of all, for those of you who have done it, the correct answer here is C. Now, why is it C? This is something called a reverse percentage increase. That means we have a number that is not the number that it was originally, essentially. It's been increased already. So it used to be something else, and now this is more than that. And we want to know what was the original number. So we're looking for the original, but we've not got the original. We've got something else. Now, in this case, we have Rachel, and Rachel's earnings include a 10% bonus. So what we've got, this is her total income with the bonus. But this is not 100%, this is 110%, because it was a 10% bonus. Now, we want to know what was it before the bonus. That's reverse percentage increases. Your formula for these is incredibly easy and these are super easy marks. You have 110%. So we convert this to a decimal so we can use it as a percentage, and percentages are difficult to use in calculations. So if I convert this to a decimal, what do I get? In the chat, because not many of you answered this. So yeah, okay, good. 1.1. So if I'm now using this as a decimal, I've got my non-original, my new, let's call it that, my new income, but I want the original. So what I do is I take 32,430 and I divide by my percentage as a decimal. That is the only difference. For all of these questions, reverse percentage increases, just remember, you do not multiply, you divide. Okay, if you can do that, you can do any of these questions very easily. Easy marks. Now, if I divide this, I get an answer that is 29,481.818. So who can round this correctly? Kind of a trick question because the answer is right there. But I know that lots of you put A. Lots of you put A. So really, really careful. This is the error that gets so many people in the UCAT. Check your rounding. You have lost marks here if you put A for no reason, because you don't get any marks if you put A, even though you did the whole calculation. So do yourself a favor, double check what is the question asking you, and double check your units and your rounding, because so many marks are lost for no reason in quantitative reasoning because of that. Each question is 1 mark, essentially, in quantitative reasoning on any of the sections. But depending, because you don't get marks, you get kind of it's a bit different for the UCAT. I can explain it later if you want, but you get points in a different way, essentially. So yeah, that's your percentages. That's your reverse percentage increases. Remember this. This is easy marks, comes up all the time. Okay. Now, we have a few things that are super important knowledge. And again, these are good questions to take a screen. These are good questions, good slides to take a screenshot of. Small hint, because these are required knowledge for the UCAT, but no one's going to give you that. No one's going to tell you that a kilogram is 2.2 pounds in the UCAT. They do occasionally. Sometimes they give you some things like a mile to kilometer. Sometimes they give you a conversion. Sometimes they don't. 52 cards in a deck and 52 weeks in a year. No one gives you that. Never. But you are required to know it. The inch and the inch to centimeter one, sometimes you get given, sometimes you don't. Just remember it. And you never get given a formula unless it's a very irregular shape. So know all your formula. I thought we didn't need to know previous knowledge. You didn't need to know previous knowledge for verbal reasoning or decision making, but you do need to know previous knowledge for this section. You are required to know GCSE maths for this section, specifically. Are you supposed to know 1 kilogram is 2.2 pounds? Yes, that's this point right here. The formulae you should be knowing are these. These are your basic formulae. I would say it's probably better to know. Oh, but okay. To be very honest with you, the ones that come up is this one comes up every year. Parallelograms have never come up to my knowledge. Spheres come up. They love cylinders. Know your cylinder formulae. I don't know what it is, but there's always questions about somebody filling up a pool. Don't know why. And you have to work out the volume of the pool. So cylinders, always know them. Trapeziums never come up. Parallelograms never come up. Circles, they love circles and they love triangles. So circles, triangles, spheres, cylinders, essentially. So yeah, that's pretty much it. The other ones I would remember, but you don't need to practice them as much because they're very unlikely to come up. They're supposed to come up in practice questions as well, but try, and the sphere and the cylinder especially, have them down 100% so that you would never forget them because they're really annoying formulae to forget. The last thing is your decimals and your percentages. You save yourself a lot of time if you know things that, like, 33%, for example, is 0.33 recurring. Because typing in 1/3 into a UCAT calculator is a bit of a hassle. So all of these, especially things like an eighth and so on, really important to remember. Do we need the cone formulae? Cones have never come up to my knowledge. You can remember it if you want, but I've not ever seen, even a practice question doesn't usually have cones, so probably not. Somebody asked me to go back to the previous slide, so I'm just going to be there for a second. And then we're going to move on to abstract reasoning. Quantitative reasoning really is one of those sections that does require prior knowledge, right? There's two sections where you need to know things already, and that's quantitative, and then the ethics section at the end, which is situational judgment. For those, you have knowledge that you need to have, essentially. Ethical knowledge or maths knowledge. The rest of them, you need to be able to read, you need to be able to draw, a Venn diagram, but it's not really knowledge. There's nothing you can study. Whereas those two, you do need to study things. If you want some resources, let me know at the end. Abstract reasoning, one of my favorite sections, really easy to improve in. I would highly recommend abstract reasoning as a section to do lots of practice in because the questions are so short that you can do so many questions in so little time. You have 14 seconds per question. So you can do, 100 questions in a small break that you have, at work, for example. Now, this is about pattern recognition. I'm going to show you an example in a second of what this looks like. But the important part here is that it's so incredibly time pressured that you need to be able to work super quickly. It's important to me that you understand that the UCAT is not a difficult exam if you can do it untimed. An untimed UCAT, most of you can probably score about 3,000. The problem is that you don't have unlimited time. You have 14 seconds. So you need to be really good at knowing when to give up on a question and just move on. You need to be really good at prioritizing the easier questions. You need to be really good at looking at something and going, that's what I think it is, and I'm going to say that this is good enough right now, and I can come back to it later if I want to. And you need to be really good at finding patterns quickly, which is the obvious part, right? But it is really important that you practice these things timed, because I've had students who've refused to do timed practice until the week before their exam, and they thought they were doing so well. But if you don't do it, if you can't do it in 14 seconds, then essentially in the exam, you cannot do it. So really, really important that you practice this timed. Now, again, we're going to look at things that you can do to improve your scores. This is what the questions look like in abstract reasoning, right? This is your classic question. What we do, this is not a real question, by the way, but what we do is we start with the simplest box. Simplest box means easy. It means there is less stuff going on, okay? That's whatever it is to you. My simplest box might not be your simplest box, but it means that whatever looks easiest to you. What looks easy to me is this box or the one at the bottom, right? So this one or this one. Then what you do is you compare. So what's the same about them and what's different? And then you go from there. And I'll show you that with an example in a second. But it's important to start with your simplest box because the pattern is found in all of set A. This is set A, it's labeled A. And whatever the pattern is, whatever the shapes have in common or don't have in common, is present in every single one of these 6 boxes. So it doesn't matter which one you look at first, okay? What we then do is we use SCANS. SCANS is an acronym that we use to look for common patterns. It stands for shape, color, arrangement, number, and symmetry. Size is also a component, and usually I do size with shape in the beginning because it's easy to find. So what you can do, and this is only in the beginning and only when you get stuck because it takes a long time, but to learn this, it's really useful. What you do is you look at what do these shapes have in common in terms of their shape? Are they both curved? Are they open? Are they regular or irregular shapes? Then you look at your color. So do they have the same color? Do they have different colors? Where are they? Are they in the middle of the box in the corner? What is different about their number? Is there always one shape or 2 shapes? How many sides do they have? Do they always have 1 side, 2 sides, 3 sides, an even or an odd number of sides? And then you look at symmetry. Are they symmetrical shapes? So that's how you go through SCANS. It takes a long time. That's why we don't do it for every question. We do it when we get stuck, and we do it in the beginning because we want to learn what to look for. Now, that's the SCANS acronym, right? And then the other thing that's important here is to watch out for distractors. Distractors are parts in your pattern that aren't part of the pattern. So there are things that are there, but they're not actually important. And that's why abstract reasoning is difficult. If it was obvious, it would be easy. But for example, if you look at this, what do you think is the pattern here? Good, some of you got it. Be specific. Some of you are very vague. Abstract reasoning patterns are incredibly specific. They're never something like there is a gray shape. It's always something like there are 2 gray shapes in every single box. And it has to be true for every single one of the boxes. Good. So there is a diamond in the top left corner. The color of the diamond varies. It doesn't matter. That's a distractor, right? It's not part of the pattern. The other shapes, not part of the pattern. They don't do anything important. They're always different. They have different colors. They don't matter. Our pattern is that there's a diamond in the top left corner. B is usually opposite. So it might be that the diamond is in the top right corner, but in this case, it's the bottom right corner. So that's where our diamond is. And again, the rest of it doesn't matter. The color of the diamond doesn't matter. The other shapes don't matter, okay? That's abstract reasoning and how it works. This is a practice question. I'm going to give you a poll, and I will see how you guys do. Remember that these patterns are incredibly specific. Because right now, 8 of you got this one right. 9 of you got this one right. You're meant to look for the pattern within the shapes. So you're looking for there's set A and there's set B. And if you're looking at the shape that is given to you, does it belong in set A or does it belong in set B? Because each set has their own rules. I'll go over what the rules are in a second. Okay, I'm going to end the poll here. You've had a minute and a half. So looking at this here, you've got set A and you've got set B. So who knows what the rule is for set A and set B? You can tell me in the chat or you can unmute and speak. By the way, if the poll is in the way, you can move the box with the poll. You can move it. Good. So lots of you got part of it, but few of you got all of it. Set A has an odd number of shapes. So 3, 5, 1, 3, 3, and so on. Set B has an even number of shapes. So 4, 2, 6, and so on. The shapes in set A always have straight edges. The shapes in set B always have curved edges. Remember how I said it's incredibly specific? This is what that means. It's incredibly specific. There's often more than one rule for you to find. So you have to be very attentive and very careful. This box here will either belong in set A, set B, or will follow neither of the rules. Now, in this case, we've got an odd number, but we've also got curved edges. Now, that means it doesn't follow the rules for A or for B. And that means it belongs in neither of the sets. So 30% of you got this one right. Don't give up too soon in these patterns. Don't go with the first thing you find because there might be more than one. A very good question is, how do you not overthink it? That's practice. Look for two different patterns. And if you find 2, you're good. If you can only find 1, then that's that, right? You might still get half of them right if you only find 1 pattern. Sometimes there is only 1, but often there's 2. How do we do it in 14 seconds? Yep, somebody very helpfully answered practice. Yeah, you do it with practice. These questions, I mean, I teach the UCAT, right? I spend all my summers, about 4 months of them, just doing these questions every single day for hours with students. So I can answer this in about 6 seconds. It's practice. It's not about natural talent. None of this is about natural talent. It's about looking at it, sticking with it, and going over it again and again and learning from your mistakes. Learn from the mistakes you make. If you get this wrong once, right, now you know. So next time you see a question like this, you go, that's very obvious that they're all curved. That's very obvious that they're all straight. So there must be something else. There might be something else. Let me check. And then you know. So you learn, right? It's just practice. Can you go back and change your answers? Yes, you can, unless the section has finished. So within the section, you can finish, you can go back, right? Somebody also said there's a flagging function. Yes. So there's an option for you to like flag your answers, that like thing in the corner, and then that marks it for later, and then you can come back to it. You don't lose any marks if you answer wrong. So if you are not sure, flag it, guess an answer, and move on, just in case you don't come back to it. You might have guessed right. You've got a 1 in 3 chance, you know? Will time from one section carry on into the next? No, it does not. Good. Let's move on because we are running out of time. And any other questions, if you need me to go back to something, if you didn't understand something, I will absolutely do in the Q&A. Okay. I'm happy to stick around and do that. But for the interest of everybody, because there's so many of you, I'm going to move on for right now. Situational judgment test changes every year in a number of questions. Sometimes it's 60, sometimes it's 69 questions, sometimes it's 22 scenarios, sometimes it's 20. It doesn't really matter. This is the only section where you don't run out of time. All the other ones, everybody goes, I can never finish that in the time. Most people do, right? With the exemption of, like, generally speaking, verbal reasoning, few people finish in the time given. Everything else, people usually finish. So if that helps, you know, I finished verbal reasoning. I had 6 minutes left at the end, I think. I finished abstract reasoning and I went over all the questions a second time. It's very much possible to do in the time. It seems impossible now. The important part is sticking with it, not losing your patience. And the most important thing is to not panic. Every single year I had a really good student last year who was doing so well and she was scoring almost 3,000 and she panicked in the exam and she got 2,200, I think. Don't panic. Stay calm, focus on the work. You know, what happens, happens. But don't overthink things and don't panic. That's the most important part when you go into the exam, right? Because you'll have done all your practice, you'll have done everything you can. But situational judgment is different because you won't run out of time here. This section, everybody usually finishes in half the time and then just kind of sits there or finishes the exam altogether if you want. You can, after that section, you're done, so you can stop essentially. What this question does is test if you have ethical reasoning skills. It tests if I give you a situation where some things are good things to do and some things are bad things to do, can you tell me if it's good or bad? Fundamentally, it's an easy section. Most people say it's very easy. Don't think it's too easy because if you score really badly in this, you're often disqualified from applying to a medical school. Somebody said, is there no time limit for a section? There is. So you have, I didn't put it here. There is a time limit. You have around 20 minutes. Everybody finishes in about 10. I've never had a student who didn't finish the section in half the time. It's not time pressured, essentially. The big thing for this is to read good medical practice. This document is essentially the answer. This gives you all the answers. Read it, make notes on it. One thing, again, this is a good thing to write down right now. One thing to remember for good medical practice is that you have differences in statements. So this document seems like it states the super obvious things. Like you look at it and you think this is dumb because I know all of these things. I know I should be honest. I know I should, whatever. But there's a difference in how they state things. Things that you must do are overriding principles. So for example, in a question, things that you must do will always be the right answer because you must do them. They're the overriding big thing. Whereas things that you should do are things that if the other one doesn't apply, then this is what you should do. It can be overridden. For example, you must maintain patient safety. That is your top priority. And for example, if you have to be dishonest to preserve patient safety, then you can do that because patient safety is more important. That's the important thing to remember when reading this. Must and should are not the same thing at all. Make a note of that. Remember what your overriding principles are. The other thing is to remember what they actually are testing. This is really important when you look at the questions themselves. So if you look at a question and the question asks you, you are a medical student on a ward, and there is somebody on your ward who is doing something that's, I don't know, let's say they're being rude to a patient. Ask yourself, what is this question asking me about? What are they testing? They're testing whether you are somebody who acts with integrity, if you have conflict resolution skills. So you know that your right answer is the answer that deals with conflict resolution skills, for example. That's the trick here, knowing what the question is asking you. All of these questions test ideal scenarios. That means they test scenarios that are very perfect, right? You have all the resources, you have all the time. And it's about what is the best answer. Ideally, in the situation, what would you like to do? In reality, this might look different because in reality, you have a lack of resources, you might be super stressed, other things. But in an ideal situation, what would you do? And that's what this section tests. The other thing is it's important to be aware of who you are. Like we saw in the virtual word round, what a medical student can do and what a doctor can do is different. Who can give me an example of something that a doctor can do that a medical student cannot do? Good. Anything else other than prescribing? See, some of these are right and some of these are wrong. So I'm going to go through all of them just to make sure we've got them. So you can keep putting them there. I will go through all of them. So yeah, medical students cannot prescribe. We can, for example, discuss a patient and offer a recommendation, but we cannot prescribe. Surgery, that's a very broad term. I've done things in surgery. I've done a skin graft, for example, in surgery when I was in plastics. Really, really cool. So that's something I can do. I was very closely supervised. There was a plastic surgeon next to me who was telling me what to do, but I could do that. Yeah, prescribing, diagnosing. Diagnosing is a very broad term. So I, for example, can see a patient and say that, oh, I think this patient has COPD or this patient has anemia. And then I hand over to a qualified doctor who will discuss the patient with me. And then that could happen. But for example, I cannot diagnose yet. Take a blood test. I can absolutely take blood. Second-year medical students take blood all the time. It's very easy, to be honest. Give medication. I've administered medication in anesthesia, for example. You can give medication. Again, it's been prescribed by a qualified doctor who's right there. And then you can give the medication under supervision, for example. Change a medical plan? Yeah, absolutely. You cannot change the treatment plan for a patient. You can take blood. Observe. I mean, yeah, you can observe as a medical student. You can observe anything where the patient allows you to be there. You cannot approve any surgeries or anything. You cannot approve it because you're not qualified to approve anything. Yeah. You can't do it. You can't make a treatment plan. Good. Yeah, good. No treatment plans. You have to always be supervised. So anything I do is supervised. For example, that's within reason, right? So when I was on placement in general surgery, I saw patients by myself. So I would go into a patient room, I would discuss with a patient about their care, about what they felt was going well for them, their symptoms, how they felt about like their treatment plan and so on. I can do that by myself, but it has to be approved by a doctor. So for example, what I would do is I would say to the junior doctor, I would say, do you mind if I speak to the patient in bed 12 about their treatment plan? And they'd be like, yeah, sure. And I would go and speak to them about their treatment plan. So if it's approved, you can absolutely do that. It depends on what year you're in as well, because fourth year is a bit different. Yeah, you can't discharge, although I've written discharge letters, they just have to be signed off by someone else. Yeah, I cannot order an X-ray. I cannot interpret an X-ray. I can be shown one and they can ask me what it shows, but I can never be the person that actually says, oh, this person has pneumonia, for example. I can say, I think this person has pneumonia, and then the consultant will say, actually, this person doesn't have pneumonia and you got it very wrong, which I'm okay at X-rays now, but happened a lot when I started because X-rays are tricky. They're trickier than they look. Yeah, and you can't order any tests. Good. Somebody asked me to go back to the last slide for a second, so I'm just going to do that for a moment. But yes, so you have to be aware of who you are in the scenario, because if you are a junior doctor, then you can prescribe medication, you can give the medication, you can do all these things without supervision. Whereas if I want to do that, if I want to give medication, then there has to be somebody stood next to me while I inject something, for example. So that's what happened in anesthesia, is I gave medication for anesthesia, but I'm not the person who prescribes it. I'm not the person who decides what they get. I'm just the person who then gets to give it under supervision. So I've learned how to do it and I get it signed off. Good. And that's basically the last thing. The last thing is word choice. Look out for words that are very positive words, right? So for example, should you be honest? Yes, honest is something positive, so you should do that. It sounds really obvious, but this has saved me on a few questions in the past. So look out for a choice of words that they use in the questions, and often it gives you kind of a bit of an idea. In situational judgment, is your role always a junior doctor? No, but they will tell you. Often you're a medical student. Good. that's it from me. We're gonna go on to Q&A now in a second. Oh wait, I'm gonna keep that for a second actually. Good. So anybody who wants me to go back to any slides, let me know now. And what I will do is I will go on to the Q&A. I'll also actually, what I'm gonna do in a second, the other thing, even if you don't want to stay for the Q&A, we're doing the giveaway, and some of you have heard that. So we're giving away our UCAT prep book, which is really good. And you don't need to do very much to get it, to be honest. You can go on the Instagram page, or you can go on the TikTok, I think. And you can like, you can comment or share anything from the Instagram page or share the conference. You can go on TikTok and like or comment on anything that we've done. This is kind of your entry into this. And then tomorrow we will pick 3 people who kind of win the giveaway. I'm not sure why I had quotation marks. You will win the giveaway. The other thing is, this is the Trustpilot page. And for medical students, it's really, really useful if we get reviews or feedback, because it helps us when we apply for jobs. For example, I'm applying for a position very soon. And this really helps us, but it also really helps Medicat to put on more events like this. So if you want to leave a review and mention our names, that really, really helps us. And we're so grateful if you can do that. And I will answer all the questions you have, but this is my kind of ask, is to just leave a review. It takes 30 seconds of your time, and we're all so grateful when you can do it. Good, I'm going to go through all the questions that I've got here. And again, there's some of the old questions up top. I probably won't be able to find them. So if you posted a question before, just put it in the chat again, that will really help. Oh, the other thing, if you don't know yet, this might help you as well. What we do is, where is it? Here. So we have a group chat so I run the group chat mostly, where we do Q&As, we do, I think there was a giveaway, and we do like prep sessions. For last year, we did lots of interview prep sessions where like I went through interview questions with people, and everybody got to try and answering them. So yeah, if you want to join that, it's very useful. It's very free. I'm going to put the link in the chat and you can join it if you want. But yeah, I'll go through the questions now. Okay, let's start at the beginning. Do we get a certificate at the end for both the sessions? Yes, you do. The certificate is based on who attended, because we can see who attended. So you get a certificate that way. I can go back to the first slide of decision making. Yes, I will do that in a second. People talk about getting signed off. Can you tell us more about this? What does it actually mean? Very good question. Being signed off for a skill or a task is, I think I have my notebook actually. So I can show you my notebook from, I'm going to have to unblur my background for this. So you can see my lovely room. This is my notebook from my placement. So what it means is you have things like, I don't have my sign-up sheet, unfortunately, but you have like notes from all your patients, and they're all anonymized because you can't give any, like have any information that's not anonymized, but you have like skills and tasks that you need to get approved for, essentially. So for example, do you guys know what a cannula is? It's like a little tube that goes in your arm. We put it in with a needle. It's very unpleasant. But for example, that's something I need to get signed off. So I need to do this under supervision. I need to be taught it, and then I need to be able to kind of do it on a patient, and it gets signed off by a consultant, essentially. If they've seen me do it, then I can get kind of a signature for that. And that means I'm qualified to do a cannula on a patient. And you have that for every single placement you do at every single medical school. There is no medical school that doesn't have sign-offs. They are a pain because you have to find someone who will teach you and who will supervise you. And some of the things you get signed off are very small, like looking at a chart, for example. And it's a bit ridiculous, but then some of them are really big things, like a cannula, for example. Do you have to like and comment, or can you just like? You can just like it. What medical school do I go to? I go to Glasgow. I'm an EU student, so I mainly apply to Scottish unis. I know about admissions I've been doing this job for a really long time, so actually I know admissions for almost every university. but I applied to King's, Edinburgh, Glasgow, and somewhere else. I can't remember. I got my offers, but I really liked Glasgow, and it's a lovely place to study. If anybody's considering Glasgow, you need a high UCAT score for Glasgow, but it is a very, very nice uni. The people are so nice. Go to a uni with nice people is my best recommendation. Visit the unis and see where you like the people, because it's very difficult to go to a uni where you feel not supported. Go somewhere where you have to be there for 6 years, you know. Go somewhere where you feel like you would be happy with the people there as well. What resources can you use to prepare for the UCAT? So what I would recommend you use is you get a practice package of some kind. Medify and MedEntry both offer one. Medify is quite good, and you have to pay for it, unfortunately, but there's like practice tests on there. That's really good to use. There is 2 free resources that I would suggest you start out with. One of them is called Past Medicine. Again, I'm going to put both of these things in the chat because I'm aware that not all of you are following along. So one of them is called Past Medicine. You have to sign up for it, but it is free. The other one is the official UCAT website, and you've already seen that. And it's quite useful, but those questions are the closest to what you will get in the exam. So I would suggest you keep those questions for the end. So this is Past Medicine. Okay, let's see. When should you start revising and preparing for the UCAT if I intend to study during the summer? And what's the case as well if I take it in September? Generally speaking, I would recommend 8 weeks. But what I recommend right now is you do a few small things. I didn't actually mention this. Thank you for reminding me. There's 2 things. There's one app called Mathical. I really like Mathical because Mathical it's free, but B, it's a very good app to learn mental maths, and that helps you so much in quantitative reasoning. It helps that the guy who made it is really really nice. The link's not working. I can see everybody else joined, so it might be it's not working for you. But you can go on TikTok and check in the bio, like somebody said, or on Instagram as well. Because if I resend it, it will be the same problem. So Mathical is very good. The other app is called Spreeder. That's for speed reading. And some people really like that. The app is free. The web-based version is expensive, so I wouldn't recommend that. But the app is free. And those are the 2 apps I would really recommend. Mathical and Spreeder, I would start both as soon as possible, essentially. That's what I would recommend you do right now. The other thing is just doing some untimed questions, for example, on Past Medicine, because they are free and you can just access them and you can just do a handful of questions to get used to the format of it. Don't do them timed. Don't worry too much about like the details of it, but do them and try and make sure that you get a good understanding of what you should still focusing on. So for example, try and focus on your mental maths, or if you don't understand this particular question type, you can still like learn it and you can look up resources. Somebody asked about where to leave a review. The QR code right here, you can scan that, or you can go on Trustpilot and look up Medicat. And we really appreciate every single review we get. It really helps us to put on events like this for you in like a free format. Where do we set the UCAT? In a testing center. It's a Pearson VUE testing center. If you've done a driving theory test, it's the same testing center. Would I need to do a separate personal statement CV for paramedic and medicine? Good question. I would ask them. Email the university where you're considering applying for paramedical science, and email university. Yeah, email university and ask them, because they will tell you. My guess is probably not. You can probably get away with not doing it, but that depends on your work experience as well. Like if your work experience is A&E, for example, then probably not. But you might have to tweak some things. It could be very similar if you have to write a separate one. Is any one section weighed more than another in the UCAT since they're worth different marks and take different amounts of time? If not, how is it scored? So every section of the UCAT is scored between 300 and 900. So every single section is worth the same amount of marks, essentially, or points, because it's equalized between the sections. So for example, I scored like 830 in verbal reasoning. And then I scored 800 in abstract reasoning. And all of those get added up at the end to make your final score. What was the name of the person who spoke about Oxbridge? Let me check who was the person who... I'll put it in the chat as well. So the people who spoke today were Mushkan about Oxbridge, not Patricia, who spoke? Sophia spoke on the virtual board round. I've put it on your message as well if other people want to see. And then my name is Anna, and I was here for the rest of it. As a GCSE student, is there anything besides focusing on my exams that I should work on? Honestly, first of all, congratulations for being here. You are very early and you are doing really well for being here, to be honest. At your stage, I would not have done this, to be honest. What I would recommend you do is try and get work experience, speak to medical students and decide if it's for you. Because GCSE is a very early point to decide to be a doctor. And I think I didn't understand what it meant to be a doctor until I went into hospitals and I did my clinical placements. Because medicine is often not what you think it is. It's very stressful. You're at constant risk for burnout, and you are responsible for people's lives. And if you make a mistake, someone can die. And that's a difficult job to do. And it's important that you are realistic about what you're getting yourself into. It is the best job in the world, right? Don't get me wrong, it's the best job in the world. But it's not a job that you should be choosing lightly. So what I would recommend you do for your CV and for yourself is try and get work experience. It's super difficult, so it's going to take you a while anyway, usually, unless you get super lucky. And try and read. Read around your subject, read books that are about medicine. Maybe people, if you want to comment on this, the message, if you have book recommendations, if you have recommendations for other things to do that you've done, then please give them to people who are, in an earlier stage of applications. Help each other. That's one big thing. I think medicine is very competitive, and people often forget that you're all in the same boat. You're working towards the same thing. You're not competing with each other. There is 40,000 of you that are applying for medicine. 40,000 people sit the UCAT. You are not competing with your friends. You're not competing with the people who are here right now. Help them, be friends with them, help the people in your medical school, help the people around you, and they will help you in return. And it's so much more rewarding. Trust me, it's so much better. So yeah, if you have recommendations for people who are currently doing GCSEs or earlier on about where to find work experience, books to read, papers to read, other things to do, they absolutely do that. There's lots of outreach programs as well. So if there's a medical school near you, many of them have outreach programs for earlier stages of applications. Those are really good and they're often free or funded. Do you need extra qualifications for the intercalation year at Oxbridge? For any intercalation year, wherever you're doing it. So I'm an intercalation student right now. I'm at Glasgow and I'm doing immunology. And the nice thing about Glasgow, for example, is that I can apply for a PhD after this. So I'm currently in the process of doing that. I'm looking at my PhD applications and I can take time out to do a PhD during my medical degree. And extra qualifications for that you have to have some experience, but for intercalation, for a bachelor intercalation, which is what everybody does, or most people do, you just need to have certain grades usually in medical school. And the rest of it is a separate application. But intercalation, wherever you're doing it, be it Oxbridge or anywhere else, usually is based on you not failing, basically. If you've not failed things, then you can probably do intercalation. In the first year we do UCAT and get a bad score, can we be resitting in the next year, even if it's a coming year to go to university? If you can't fail the UCAT, but if you get a bad score and you apply, then you will probably be rejected by most universities if you get a truly bad score, right? But most people don't get a truly bad score, like most people get a decent score. But you cannot apply, for example, now and then use that score to go to university in September. You have to sit the UCAT in the year of the application cycle. So to answer your question, you would then have to reapply. You cannot use it to then go to university in September if you sit the UCAT in August, for example. You get extra time for UCAT if you're currently eligible. Yes, but you have to apply for it and you have to have the documents for it. So do it early on because it's a bit of a hassle from what I've seen. Resources I've already put in the chat. You can also, if you need help, Medicat does, so I run some of this. So if you don't like me, maybe you'll get a different tutor for it. If you do like me, great, you'll hopefully get me. We run an interview masterclass, which is a crash course of the UCAT. In 2 days, we go through the main sections of the UCAT, lots and lots and lots of practice questions, and we answer all of those kind of trick questions and show you how to work through them. I can put a link in the chat for those of you who might want it. It's a really, really good opportunity to do lots of things in a very short time. And I highly recommend using it if you are just starting. Because if you are doing the course when you already know lots of things, and sometimes it's not as useful, but it's very useful if you are doing it when you're just starting your revision, because it teaches you the right way to do things. There's also, somebody else asked, there's also tutors for the UCAT. So if you want one-to-one tutoring, we have lots of tutors who achieved really highly in the UCAT. I've had so many UCAT students. I had over 100 UCAT students last year, and some of them got truly amazing scores, and they're off to like, they've got amazing offers from amazing universities now. So especially if you're aiming for a university that is very, very high in the UCAT. So for example, King's, if you want to go to Nottingham, if you want to go to Cambridge, I recommend getting all the help you can, whatever that is, and however that looks for you. Okay. How do we get the certificate? You will still get a certificate if you attended. That's managed by somebody else, but certificates are sent out after tomorrow. No, your certificate will still be in the right name. It's about the link you signed up with, I think. It's about how you signed up for it. And that's the name that should be on your certificate, I think. What year medical school am I in? I'm in my 4th year. Glasgow does intercalation after the 3rd year, unlike other universities, because we get a full bachelor's degree out of it. It's slightly different, and it's because the PhD program, it's a whole thing. But I'm in my 4th year, essentially. I've done clinical placements. I'm currently in my integrated degree in immunology. Highly recommend immunology for any of you considering intercalation in the future. It's great, so applicable to all of medicine. Love it. Love the lab. Love lab work. Slightly off topic, but I was in the lab so long this week, but my project is going really well, so I'm just super excited. Do units like Queen Mary's, King's, and Imperial accept grade 6+ from GCSE? King's will score your GCSEs. Not sure about Imperial next year. King's has been fairly consistent in scoring your GCSEs. Check in the summer. They will publish their entry requirements. Many of them accept you with grade 6, but often they're scored. That means that even though you meet the minimum requirements, you're at disadvantage to people who've got higher grades than you. What are the ideal GCSE scores needed? The ideal score is if you've got all 9s. Very few of you will have that. It's fine. You can go to medical school if you've got 7s and 6s, but you have to apply strategically. Don't apply to universities that score your GCSEs really highly, like Leicester, for example, if you haven't got the GCSE grades for it. Again, if you are really lost, that's something that we can help with, and you can get in touch with Medicat, and they will arrange for you to have a consultation about where the best places for you to apply are, because that's really important. Often people do really well, and then they apply wherever, and they don't look at the requirements, they get rejected. And it's so sad because often these people have really good grades, really good UCAT scores. So be really careful, look at all the information and get help if you need it, because that's the part that's really, really important. What do you mean by Nottingham doubling your VR score? So for example, if you have, let's say, I'll give you my scores, or what I remember my scores are, like 710, 780, and 800, right? That's VR, that's decision-making, that's QR, and that's AR. Again, apologies for the handwriting. What they will do is they will double the score for verbal reasoning and then use that to score your overall application. So instead of just taking your score and adding it up to be whatever it is, they will say that, oh, you scored 830 in verbal reasoning. So what we'll say is we'll double that, and then we'll add up all the other numbers, and that's the score we'll use that gives you points, essentially. It's a bit complicated, but it just means that verbal reasoning is much more important if you're applying to Nottingham, for example. And that was last year. I cannot guarantee it's the same for next year, but they've done this for the past few years, so we're expecting it to stay the same. Could I say my A-level subjects and scores and your UCAT score? My UCAT score, I've just shown you, was around 3,070, I think. My grades were A star, A, plus an A star in EPQ. And I did my EPQ in astrophysics, and I did biology at A star, physics at A star, and chemistry at A, which I'm still slightly upset about because I was actually quite good at chemistry, but happens. My grades and my UCAT score were fairly good, so I had a pick of some universities, and that's really, really helpful. It opens doors for you. Like I said, the UCAT score isn't, the world doesn't end if you get a bad UCAT score. It doesn't, contrary to what people think. But it makes it so much easier for you if you have got a good UCAT score. So much easier. You have so many doors open for you. So if you put effort into anything, you will spend forever finding work experience. It will be exhausting. It will all be a bit tedious, right? But it'll be the really good parts when you do the work experience, when you get your applications done, when you celebrate, when you get an interview. But keep in mind that the most important thing you will do is your UCAT. That's what gets you your interviews. And if you don't have an interview, you don't have the chance, right? So if you put effort into anything, let it be the UCAT, essentially. I'll post the link for the dentistry group chat as well. So you can have that if you want. The dentistry group chat, I do some things with, but I'm not a dental student. So some of it is run by somebody else. And she is the loveliest person. Everybody in dentistry chat is so nice. So if you are a dentist applying, please join the chat. They are the nicest people you will ever meet on there. Okay. Where was I? Yes, dentistry chat. 6 and 7 at GCSE enough to get accepted to medical school, such as King's or Imperial. It depends what subject. It depends how many 6s and 7s. And it depends on your UCAT score. If you've got, 3,000 at UCAT, then probably, although I can't guarantee it. But I'm not sure about Imperial, actually. King's scores your GCSEs fairly heavily. So King's is a bit more tricky. I will also say, like, I got my offer from King's despite not having GCSEs, because I moved to the UK when I was 16. So I didn't do GCSEs. And they can figure out ways, if you are an international student, to score you without GCSEs. But then your UCAT score is super important for anybody who's like an international student thinking of applying to King's. How would you go about getting someone like you to help learn UCAT? So what you can do is get in touch with Medicat. On Instagram, you can send them a message. I can share their number, or you can just, like, there's a form on the website as well that you can look at. It's you can request specific tutors. So what you can do is you can request me, for example, if you want. I'm currently not taking very many students, but I take some. And there's lots of really, really good UCAT tutors. Like, if you don't want me, that's absolutely fine as well. We have lots of really high scoring tutors who are really good at teaching. And many of them, like Sophia, for example, have been doing this for a really, really long time. So we know the questions in and out, and we know exactly where people kind of falter, and we know exactly how things can go wrong, and we know how to prevent that. If your A-level grades, UCAT and interview all go well, but GCSE are bad, like some 5s, how will that affect you? It will affect you in the early stage. So if your GCSEs are actually bad, 5s are not terrible, then you can't apply to universities that score your GCSEs heavily. Like King's, like Leicester, is tricky because you won't get the interview. So you will never get the interview stage if you don't score their kind of requirement from their GCSE grades. So for example, what some universities do is they give you 1 point if you get a 5. So 5s give you 1 point, 6 give you 2 points, and so on, right? And you need to meet like 36 points. If you don't meet that point requirement, then you don't get an interview. You can absolutely apply with 5s at GCSE. I'm not saying you cannot, but I'm saying you have to be more careful. Look at the university websites, get someone to help you, because double checking, triple checking everything is so important. There are so many medical schools. Many of them just look at minimum requirements for GCSE. Get a great UCAT score, you'll be fine. Okay, it's not the end of the world. Just get a good UCAT score. Preferably a great UCAT score, but a good UCAT score, and you won't have your pick of all the universities, but you'll have your pick of many universities. Okay, so it's not over. When you get the certificate, after tomorrow, it would come out sometime next week. Somebody replied to the giveaway. How to spell the app? Yep, I put it in the chat. Certificates are usually emailed, yes. My name, also somebody asked, my name is Anna. If you get rejected from medicine from all the universities, can you apply in January of the same year for a different course? Not usually, no, because it shows up as a rejection and not a withdrawal. So you wouldn't be able to apply for a different course. You would be able to apply through clearing, and often there is nursing and clearing if you wanted to do that. But what I don't recommend is applying for a different course if you don't want to do it. Because if you do not want to be a nurse and you're just doing it because you didn't get into medicine, that's not a good reason to do nursing. Nursing is a very different degree. I had a student, and this is a student, I think I said this before, this was, I don't have favorites, right? But I've been teaching her for 2 years, and she's the loveliest girl. And she was trying so hard, and she didn't get into medicine the first time around. And she had an offer for pharmacy. And she called me when she got rejected, and she called me when she got the offer for pharmacy, and she asked me, Anna, do you think I should be doing this? Do you think I should just go for pharmacy? Because I don't think I will get into medicine. And I asked her, do you want to do pharmacy? Is that a job that you want to do? Is that a degree you want to do? And she said, not really. And that's the question, is, do you really want to do that? Because it's a long degree to do if you don't like it. So if you're just doing it because you didn't get into medicine the first time round, then try again. Many people take a gap year, and gap year applicants do incredibly well, not only in applications, but at university. Some of the best students I know are gap year applicants. So if you really want to do nursing, if you don't mind, if you want to do ophthalmology and you don't really mind doing that, great, you can do that. But if you're just doing it because it's there and it's easier, and you really want to do medicine, then I would say reapply. When will the recording of this be available? So this recording is quite large and it's being processed on my computer. So the honest answer for this is I don't know, because it depends how well my computer does. The next few days is the kind of answer I can give you. I don't know. Would work experience completed before starting A-level still contribute to university application, or is it more recent experience that's required? You can still use kind of older work experience if you want. There is no official requirement. I would say try and get some more recent one as well, even if it's online, that's perfectly fine, but it's often good to have like a variety of experience. Universities love long-term volunteering. This is your safety net, right? If everything else fails, if you bomb the UCAT, if your A-levels end up with 3 A's, which is really good, like I'm not saying it's not good, but I'm saying it's not enough to get you into university like King's, for example, then your safety net is long-term volunteering, because universities like Kiel and Sunderland don't care. They don't care if you've got a really high UCAT score. They don't care if you've got 3 A's or A-star AA, although Kiel might be A-star AA now. But they do care if you've got long-term volunteering, for example. And then even if you bomb your UCAT, you can still go to medical school. And Kiel, I've got a friend at Kiel, is a really good medical school. Like, I'm saying to somebody, like Glasgow is renowned for being fairly good. Teaching at Kiel is, making me reconsider. You can still do all of these things, but you need to create safety nets for yourself. And long-term volunteering is what's scored by those universities, not work experience, volunteering. Have you done things for your community? Have you cared for other people? Have you done things to show that you are a person that's passionate about helping others? That answers the second question as well. Could work experience be done through volunteering? Yes, and it's the best kind of work experience. I did long-term volunteering. It really helped me in interviews. But also I did an internship with the Red Cross for at-home nursing. That's also really good if you can get something like that. It was a month of my time. It was in the summer. I had to be there at 5 a.m. It was great. I loved it, to be honest. But it's a month of your life that is just, it teaches you so much, and you can really use it for your applications. Do universities publish the scores that they require for the UCAT? There's lots of response to this, so I'm just gonna go through these. So yeah, the answer is kind of right. So Universities publish scores from the past few years. They publish what score did you need in 2023, for example, to get into medicine here. Some of them do, not all of them do. They're often difficult to find, and some of them have an official cutoff. They might say you need a minimum of 2,200 or 2,400 to apply. That does not mean that if you score that, you will be invited to interview. It means if you do not score this, you are disqualified. They might then still score you or rank you based on your UCAT. So the answer is yes and no. They publish past scores, which give you an indication, but they do not usually give you a score that says, if you score this, you are invited to interview. You can look at past data. Again, we can help with that if you need help. You can get in touch with Medicat and then they will help you. But that's once you've sat your UCAT, that's long away. Thank you for a response from somebody there. Yes, I recommend 8 weeks for the UCAT, but like gentle starts now, so you know what to focus on. Oh yes, so your UCAT score gets published immediately after you've done the exam. You get it when you leave the UCAT, you get an envelope or sometimes just a folded sheet of paper, and it has your scores on it. It's really nerve-wracking. I recommend not opening it in the test center. Thank you so much for recommendations for the books, and thank you so much for the people who left reviews. A very good question. Is the legal side of things of medicine a worry? Is it a thing that you could get taken to court for mistakes and stuff like that? Kind of. You can get taken to court for some things, but you have medical indemnity insurance. So that insures you against many things, essentially. Mostly the GMC regulates you. So that means that the GMC does things like take your medical license, essentially, if you make a big mistake. But mistakes, the culture around mistakes is changing in medicine. So eventually you will make a mistake. And many, many people in medicine, almost all doctors, will make a mistake that kills a patient. It's a very sad reality, but every human is fallible. So you cannot take the medical license of somebody just because they've made a mistake once, because not many people would still hold a medical license. But it depends on what the mistake was and why you made it, essentially. So if it happened because you were understaffed, you were doing an extra shift that you didn't sign up for and everything like that, if it's a product of circumstances, then it's different to just making a careless mistake, for example. I had a question about grad entry medicine support. Yes, we do offer grad entry medicine support. Do we have to do the personal statement again when applying for intercalation? Really good question. I had to do an application essay, but it's quite short. It's like 1,000 words. It's not very long. And you just have to talk about why you want to do it, essentially. But yeah, very good question. What's considered a bad UCAT score? Anything below average. So if you have bad UCAT score, I would consider it to be like below 2,500. That makes it more tricky for you to apply. You can still apply, but it makes your life a lot harder. A good UCAT score is 2,800 is really good. That's kind of the aim. 2,800, 3,000 gets you into almost all medical schools. So if you can score 3,000 and you apply to a university that's UCAT heavy and you meet kind of the other requirements, then it's pretty easy. How do we get tutors for the UCAT? I'm going to send you a link for that. And you can use that to see if you want to do something. So there's also this, by the way, which I should go back to. You have a discount code. So if you are thinking about getting a tutor, please use a discount code because you get money off. So, if you are doing it, please do use the discount code. Yes, so thank you for the person who answered this. The session tomorrow is different. I had a question about which medical schools offer integrated PhD. I only know Glasgow and Edinburgh offer it. There's definitely other schools as well that offer it, but it's very competitive and it depends on where you go. So yeah, it depends on the medical school. The Glasgow one is quite good because it's very, very supportive. I've got lots of support with my application, but other schools might be different. I know Glasgow and Edinburgh definitely offer it. How do you find out what universities weigh the most? On their website, generally speaking. They will often tell you how they score your application, or they should tell you how they score your application. Are King's more likely to accept you if you have average GCSE grades but high UCAT and A-level grades? King's is heavy on their GCSEs, to be honest. King's has quite high entry requirements for both of them. So usually you need fairly good scores across the board, but it depends what you consider average GCSE grades. You know, like if you've got 8s and 9s in there, then I can't say for sure because I don't know your specific circumstances. I can't give advice like this because when I do this for students, it takes me about an hour to do, to like figure out like what is the right universities to apply to. So I can't do this in this amount of time, essentially. It's very, very complicated and lots of factors go into it. Do they double it for everyone? I don't know what you mean by that. How do you find out what universities score English language GCSE highly? You look on their website. Lots of them will score it, but they will score it as like a required GCSE often. I go to Glasgow. Would you say an EPQ is beneficial to a medical application? Yes, I loved it. And I think it was so useful in my interviews because my EPQ had nothing to do with medicine. I did it on astrophysics and planetary science, you know, because I really liked physics. And I wanted to do some more physics before I went off to university, because I wasn't going to do physics as a degree. So I would say really, really useful, because you can show that you've got research skills, you can show that you've got independent thinking skills, and universities like it. Some will lower your grade requirements, like Leicester, for example. Some others will also do that. And you can, if you slip a grade and you get AAB, for example, you can still get in. Can homeschool students apply? Yes. If you're doing A-levels, then yes. Does Queen Mary's care about GCSE very much, or does it focus more on UCAT? Queen Mary's is changing their applications scoring, so I don't know. You will have to check next year. How do you know which universities score GCSEs heavily? Is it on their website? Yes, it usually is. There are lots and lots of medical schools. The ones that I would say score GCSEs quite highly, for like at least 50% of their score, are universities like Leicester, places like Dundee, Hull, York gives lots of points to GCSEs. Leeds gives a lot of GCSE points from what I know. Queen's Belfast, Cardiff, although you need very, very high grades for some of these. I'm talking all 9s. Do you think you can start preparing for the UCAT too early? Yes, you can. I would not recommend you do timed practice right now because it would burn you out by the time you get to the UCAT. Gentle practice, start with untimed practice, you know. I would absolutely do that, but don't start doing timed practice right now. 10 weeks is the most I would recommend. If English is not your first language and you're struggling with the reading aspect of it, then spend more time reading English before that. I've had some students, I have a student from the Ukraine right now, and she needs to prepare by essentially improving her English because she doesn't speak very much English. And that's different, right? But other than that, I would say try and do 10 weeks at most. Can you tell me a bit more about being an international student? For example, are you able to get any funding or financial aid? I am not an international student. I am an EU student, which is different when I applied. So my university degree is actually funded by the government, by the Scottish government. I do not pay a single penny, but I do not get financial aid, which means there was a question before about working during medical school. And I think somebody said that like to not do that. I will tell you that people will tell you not to work during medical school. The reality is that I work during medical school, and I work quite a lot of hours sometimes, like 20 hours a week, 30 hours a week. Not always, not during exam times, but it is very much doable. People will tell you that you shouldn't be doing it or it's not a good use of your time. Fundamentally, if you need the money to live, then you will have to do it. And it's doable. It absolutely is. You can apply for some financial aid depending on the university. Glasgow gives financial aid for some students. I'm not eligible for it, unfortunately, and my government doesn't give me money, unfortunately, but you can absolutely work during medical school. I still have free time. I did well enough in medical school to apply for a PhD while working. It depends on the medical school you go to. Glasgow is very good for work-life balance, is all I will say. You have a lot of self-study time. You have a lot of time that you can manage yourself. So if you want a university that's supportive and has kind of a lot of self-study time, has a lot of we're quite good for work-life balance, essentially. Yeah, during exam times, everybody's stressed, but other than that, then Glasgow's a very good choice. But essentially, as far as being an international student goes, I can't give very much advice. There is financial aid available, but it will depend on your government as well, because often your government can give you financial aid. I've got lots of international student friends who get their degree funded by their government. Somebody asked the question about Nat 5s. Thank you, that's really good. Are 7, 8s, and 9s at GCSE 3 points each? That depends on the university. Each university will score it differently. The GCSE point system will depend on the university you apply to. It isn't the same for every university. So what I showed you was an example from Nottingham or Leicester. They scored very similarly, and you get certain amounts of points. So if you stick around at the end, I can show you what it actually looks like, but it depends on the university. When should I start doing UCAT prep, and what should I start with? Start with Mathical and Spreeder for prep. Do questions untimed for now, occasionally just looking at them, going through them, and then start doing your timed practice kind of 8 weeks out. What would you do in a gap year? Most of the students I know worked because money, and because it's something to do. You can volunteer, you can travel if you've got the money to do it and the resources. I've got 2 students at the moment who took a gap year because they've got sick relatives. So that's why they took a gap year, and that's what they're doing. The university wants to see that you've done something. So you cannot say, oh, I've, not really done anything during my gap year, or, I'm just trying to figure things out. Even if it's a part-time job, even if it's volunteering twice a week, do something, whatever you want, essentially, but have something there that you want to do. How long is long-term volunteering? I think I would always consider it a year by the time you apply. Yes, so the question about clinical assistant, counter volunteering and working with patients, if you get paid for it, it's not volunteering. So if you get paid for it as a job, you can still use it. It's still really, really good in the application. No one's going to give you less points because you were paid for it, but it's not volunteering. So you can't put it down under volunteering. You have to put it down under paid employment. How long do you recommend volunteering for? Ideally, a year. 6 months is also good. The UCAT is set in Pearson VUE testing centers. Do universities look at EPQ? Yes, they do, some of them. You can always bring it up at interview. Some of them will give you points in your application for doing an EPQ as well. Leicester, for example, does that. Some other universities that do that as well. So Lancaster, Hull, York, they also give you points for doing an EPQ. Should we start looking at UCAT questions now? I've answered this multiple times, so yes, but untimed and very slowly. This is the same question again. Is there a link for a certificate? No, it will be sent to you. Are Oxford medical degrees worth more than medical degrees from other universities? No, a medical degree is a medical degree. They are not worth more. Actually, for those of you who care about this, once you finish medical school, the way you get your places and everything is completely irrelevant to your medical school. No one's ever asking. It's not in any application. No one cares, essentially. Go to the medical school that you like. If you want to go to Cambridge, absolutely go to Cambridge. If you look at Cambridge and you think, actually, I don't like that, but it's a really good uni and maybe I should go because it's so respected and it's so well known, don't go. Because you have to go somewhere where you can learn. Medical degrees, you can get honors. And what you want is to get honors because that helps you in the future. And that means going somewhere where you can learn, where you get all the opportunities and where you feel comfortable and supported. If that's not Oxbridge, that's perfectly fine. Go wherever you want. I've answered this before. Is it common to have your medical license taken away? What would be the circumstances? Because surely the only mistakes ever made are circumstantial, I would hope, bar a few. So if you know Harold Shipman, for example, something like that, like murdering your patients, obviously gets your medical license taken away, but also other things, like sometimes there are other circumstances where somebody has made a very serious mistake, you gotta get your license taken away, or unprofessional conduct. So for example, if you threatened a patient, if you post something very inappropriate on social media. I think there was a doctor who got his license taken because of misinformation, because he was spreading lies about the medical field online, stuff like that. So malicious, if you're doing something maliciously to harm patients or doctors, then yes, you would probably get your license taken. Any tips for graduate entry? Graduate entry medicine has the highest UCAT requirement you can possibly think of. So what you need to do is sit down and try and get the best UCAT score you can possibly get. And I mean 3,000. I know people who got rejected with UCAT scores that were so good that they could have gone to any course as an undergraduate. But graduate entry medicine is either a graduate entry, a graduate course, which can get funded and is kind of less, it gets funded by the government, or you have the undergraduate course, which you can still apply for, but then you don't get your funding and you have to pay for it yourself, which is expensive. If you want to apply for those, absolutely fine, less requirements, you're probably fine. But graduate entry medicine is actually very difficult, so you need a very, very high UCAT score, essentially. That's my advice. And always check that they accept your previous degree, because sometimes they need you to have a specific degree, like biomedical science. And sometimes they will accept any degree or a pharmacy degree as well and stuff like that. So double check that. I live in Scotland. I'm thinking about taking chemistry, biology, and maths for advanced higher. I also want to take higher Italian, as I already know the language, but might need to practice a little bit comparing it to a good result. Should I still take it? And then you don't need four. You do not need four advanced hires. No university requires you to have four. Take the ones you like. Chemistry is usually important. Yeah, I wouldn't do four, would be my recommendation. Any A-level physics tips? A-level physics was my favorite subject by a long shot. Like, loved it. Never wanted to do a degree, but loved physics. My advice is physics teaches you how to think, right? That's why I like physics. It teaches you how to think about things. So for the questions, what you're doing, always think about why you're doing things as you're doing them. Do all the past papers, all of them, because they are the best resource you will have. But if you're looking at a question and you don't know what to do, just do what you can do, right? Even if you don't know what the question means, look at the information you were given, at the data given, at the measurements given, whatever, and do the calculations that, reasonably speaking, you can do with the data available. I got so many marks in physics when I had no idea what was going on, because I just did. Like, the data was there, and I was like, well, that's the only thing I can do with what you've given me, so that's what I did. And I got full marks sometimes. So that's my advice. Physics is great. Honestly, enjoy it. I love particle physics as well. What's been my favorite moment or module of medicine so far? That's such a lovely question. Thank you for that. My favorite moment in medicine, I've had two. I'll tell you what two. My favorite moment that I had in my degree so far has been this week, during my intercalated degree in immunology, because I'm doing a study that looks at, again, this doesn't need to mean anything to you, but I'm looking at how Th17 cells behave in patients who have axSpA, which is a very kind of rare disease of the spine. Well, not rare, it's a disease of the spine. And I need to get samples from participants. I need to get samples from people in the clinic. And that was really difficult. You can barely get a sample. And there was an older man and he volunteered for a sample and he gave me 5 tubes of his blood. And that was my favorite moment so far, because I got that sample and I was in the lab until midnight to analyze it. And this moment of like achievement that you feel is so lovely. And it's so nice because these people want to help you. They want to help you do research. They want to help you learn. So that was my favorite moment that I've had so far. But my favorite moment with a patient was when I spoke to this patient who was elderly and she had lost her son. And she was a very, very lovely woman. And she did not deserve anything horrible happened to her. And she had all the symptoms of cancer as well. So it was a really difficult situation. And I was in placement on GP. And in GP, if you know, you have 8 minutes, 10 minutes per patient. And she had so many problems and she was so sad and she had nobody to talk to, no one at all. And because I'm a medical student, I saw her before she went into the GP and I talked to her for 2 hours. And we just talked through everything that was bothering her, because she was sad and she was feeling so horrible about life, and because her son had died like exactly a year before and it was really sudden, and and it was so nice because I could help her, right? I didn't get to prescribe medication. I didn't get to, do bloods or run a test or anything. But by the fact that I was there and I had time, and you have time as a medical student, you get to help people by just being there and listening to them. And that helps so much more than you can possibly imagine. And that woman left and she was smiling, and she had cried for an hour during that consultation. But she left and she was smiling and she felt better, even though her life was still not great, right? Even though her son was still dead, and even though she, still had all the symptoms of cancer, she felt better because somebody listened to her and she got to talk through her problems. And that's one of those moments as a medical student that you never forget. And I will never, ever forget her. She was the loveliest patient. And I learned so much from seeing patients like her, because you learn so much about what empathy means. Because empathy is a term that's thrown around a lot, but you don't understand what empathy means to a person until you have a patient like that. So that was my favorite moment, because I got to help her in a way that you don't often get to do. And it's a huge privilege. You're so privileged as a medical student that people trust you and they let you help them. So yeah, that's my absolute favorite moment. But thank you for that question, guys. That was a really nice question. I had a question about the EPQ. You're not disadvantaged by not doing an EPQ. No. It helps you a bit for some things, but you're not at a disadvantage if you don't do it. I don't do sessions for a GAMSAT, but we do have a GAMSAT tutor, as far as I'm aware. So you can contact Medicat and they will put you in touch. Do English students come under a separate quota when applying to Scottish unis? Yes, they do. So you can apply for an English place if you're from England, and that's different to a Scottish place. That's not because Scottish universities prefer Scottish students, it's because of how they're funded by the government. So often the requirements are higher for English students. Would you recommend a gap year over graduate entry medicine? Yes, because graduate entry medicine is extremely competitive, and you have to do a full degree that you maybe don't want to do if you want to go for graduate entry medicine. Would you need all 9s? No, you rarely need all 9s, but you need high GCSEs, like 8s and 9s, maybe a 7 in like French or something like that. What job is feasible to have if you're studying medicine? Could you do something like retail, or would you have to focus on something like tutoring? You can do whatever you want, essentially. I know people who work in retail. So many of my friends have jobs. It's not just me. I know friends who work in retail. I know a guy who's a sailing instructor. I do tutoring. Other people do tutoring as well. I've got another job as well, which is slightly different, where I work for the university in kind of preparing like admin stuff. You can do admin jobs at the uni. You can work at the university. So Glasgow, for example, has lots of jobs on campus where you're a campus helper, and you essentially help people who are new to the university figure out like how the printers work, where the library is, where to find books and stuff like that. It's really lovely. It gets paid fairly well, and you don't do very much. So yeah, there's lots of jobs. Is it worth taking tuition for interviews? Are they similar or accurate? Is it better to just know your personal statement and be confident? As someone who didn't do prep for interviews, in hindsight, I would definitely do it, because interviews are so important. Like at the point where you're at the interview, they don't really count anything else anymore. So if you mess up your interview, that's it. I would always do it. At least a mock interview if you can. There's people who volunteer for that. We have bursaries for students as well if you can't afford to pay for it. But I would always recommend that you try and get experience, you try and get practice, because practice really makes a lot of a difference for interviews. Is long-term volunteering in a charity job useful? Yes, it is. Did you apply to Oxbridge? Why not? I think Oxbridge is for certain people. And if you like the kind of style of Oxbridge, if you like that the split between preclinical and clinical is there, then that's absolutely for you. I didn't think I would like that, because I was quite scared of patient contact. I was quite scared to see patients. And I knew if I put it off for 3 years and I didn't see a patient, I was only focused on the science side of things and only learning like the theory, I would be terrified to see a patient. I would feel so underqualified. And yeah, it depends on if it's for you. I think some people really like it. It's definitely for some people. I went and I looked at it and I didn't like it. But it depends if it's for you. Do you get to choose where you work after medical school? You put in a ranking of where you want to go, and they try to give you as high a place as possible on your list. So you get to rank every single place and then you get assigned somewhere. Is having 2 sets of GCSEs a disadvantage? No, not usually. Is it true that universities check your social media accounts? If yes, then what if you don't upload anything? Could it be used as a tool to boost your application? Just wondering. For applications, they don't check them. No one checks the social media account because there's 40,000 people. They can't. What they can do is if you've posted anything hugely concerning, somebody might report you. That can happen, but that's only if you've posted something that's, homophobic or racist or sexist. Like, if you're a normal person, you're fine. It's recommended you don't post anything extremely, radically political on your accounts as a medical student, because you do represent all doctors. And if you have views that are very extreme, then it's not recommended you do that, essentially. That's the only thing I would say. Unis outside Scotland accepts SQA results. Yes, they do. You can apply with Scottish Highers and Advanced Highers. Yes, you can. So if you apply with extra time, it's absolutely the same. No, you get extra time for the UCAT if you apply for it. Which universities take English into high account? Quite a few of them. You'll have to check the websites in the summer when they publish their admission stuff. Would you recommend doing an EPQ if you had to do it in year 13? Very good question. Difficult question. Depends how you're doing in your other subjects. If you think that confidently you can get A stars in all your subjects and still do the EPQ, do it. If you think that you are currently sitting at getting 3 A's and you're not entirely sure if you can do the EPQ on top of that, then leave it, because it's not worth it. If you don't get your A-level grades, then you are in trouble. And then you have to do foundation year programs or access courses, and it's a huge hassle. It's possible, but it's a hassle. So I don't recommend it. What are the Scottish requirements for applying to Oxbridge? You'll have to check with the individual colleges. There is no easy answer I can give you for that. You have to apply. You have to look at the individual colleges and you have to email them, because every single college for Cambridge and Oxford has different entry requirements. So yeah, it's a bit of a hassle. Pick a few colleges, email them, ask them, or it might be on their website. Can you do an EPQ outside of school if your school doesn't do it? Yes, you can. You will have to pay for it. Are very good GCSE grades important for applications? It depends on where you want to apply. So if you want to apply to a university that scores GCSE highly, like King's or Nottingham or Leicester, then yes. If you want to apply to a university that, like Glasgow does not care about your GCSE grades one bit, could not care less. So depends, essentially, where you apply. Some universities score them, some universities don't. Worry about strategic applications once you've sat the UCAT, because once you've sat the UCAT, you know what you're looking at. You know, if you've got the high UCAT, then you've got lots of doors open. If you haven't got the high UCAT, you're in a bit more trouble, right? So yeah, try and worry about that once you've got your UCAT score. For right now, focus on getting the highest UCAT score possible, essentially. Good. Any more questions before I finish up? You guys have been so great. Thank you so much for coming along. For those of you who are still here, if you do want to leave a review, this is a QR code for a Trustpilot website. We're really grateful if you leave us reviews. It really helps us. But yeah, if you have any kind of other questions that you didn't want to say before, you can stick around for a moment. I'll leave the Zoom open for like 5 minutes. And then, yeah, I'm not here tomorrow, but everybody who's coming back tomorrow, good luck for that. It's going to be super, super good. I've seen the program, so it looks really good. And yeah, enjoy the application process. It's honestly, it's a good time. It's stressful, but it's super lovely. And I really hope all of you do really well. The universities look at grade bands for Scottish Highers. No, they don't. Usually, no. Can Medica do one-to-one tutoring for A-levels? Yes, they do. Yes. I can send you a link, but if you get in touch, then that's quite good to do. But yeah, just get in touch with Medicat if you need any more help. They will be able to help you. If you got mostly A's and a few A stars at GCSE, can you still apply to KCL? Yes, but it will depend on your UCAT. And again, it depends on the year. It depends on who else is applying, but yes. Will I be disadvantaged while applying if I'm a homeschooling student over students from normal schools? I have all A stars at GCSE. No, if you sat your GCSEs all in 1 year, if you sat your GCSEs the way that anybody else sat their GCSEs, then they cannot disadvantage you. If you sat your GCSEs over multiple years, that's a different story. But if you sat them the same as any other student, then you'll be treated the same as any other student. Would Oxbridge care about grade bands? Not usually, no. Never seen anything that says that, or heard anything from the other tutors. Do KCL care more about GCSEs or the UCAT? They take into account both. They don't publish their exact requirements, but you generally, for Kings, you always need high GCSEs and a high UCAT, usually. If you're widening participation, then that's a slightly different story, but usually you need high grades and a high UCAT. Do Medical help with GAMSAT? Yes, we can help with the GAMSAT, usually. I think we have tutors for GAMSAT. Send a message and they should be able to put you in touch. What is considered highest GCSEs? Is it 8 or 9s or 7s? I would consider high GCSEs 8s and 9s. If you've got a 7 in something, and that's fine. But keeping in mind that, high GCSEs aren't the end of the, it's not the beginning and end of everything. There's many, many universities that don't really look at GCSEs at all. So if you haven't got 8s and 9s for every subject, then that's fine as well. There's some universities I wouldn't suggest you apply to if you've got like 6s and 7s at GCSE, but there's definitely enough universities you can still apply to. It's just if you've got your heart set on one university that really has really high GCSE requirements, like Cardiff, for example, then that's a lot more tricky. Okay, guys, then I think that's it from me. Good luck to all of you. I'm going to end the Zoom now, but yeah, if you have any questions, like now is the moment to send them before I end the Zoom. But yeah. Okay, then good luck, everybody. Which unis don't focus on GCSEs? It depends on the year you're applying. There's a long list. So on the top of my head, Glasgow isn't GCSE heavy. Bristol doesn't really care about GCSEs. I'm not sure how much UCL cares, to be honest. Universities that just rank you by UCAT, for example, they like Anglia Ruskin, Edge Hill, Liverpool, Manchester, Southampton, St Andrews. They're not very GCSE heavy. Sheffield. Universities that are really heavy on the UCAT don't care about GCSEs as much, essentially. Good. Okay. Thank you all so much for coming along. I'm going to end the Zoom now.